Hey everybody, thanks for joining us. And like Samantha said, there'll probably be a couple impromptu like little things that we do. It'll probably be based more on your guys' questions than like something that I'm wanting to put forward. But we're trying to refine how we present this information to you guys in these free classes for the class conditions, so that you don't have to scramble around to find other information. Or so here we laid out like a definition for the respiratory system, and each condition kind of has like a little bit of an overview of what it is and like some symptoms and potential causes, and then the treatment. And so sometimes when we're presenting information, we might not know like what the symptoms are, but we know like the word or the name, like asthma, for example, which will be the first thing we talk about. We kind of know some of the things about asthma, but we don't know the symptoms. We don't know causes. We might know a little bit, but I'm trying to lay these things out so it makes it easier and easier for you guys to evaluate a situation and be able to treat something based on what's presented. Sometimes somebody has like a diagnosis, but a lot of times, even as a healer, people would come to me for healing with what they thought the condition was. And as you'd go through and evaluate the symptoms, sometimes they'd be accurate, and sometimes there was things that were kind of close to it but different. And so I don't want to make it so that you guys have to do a lot of study, but if you know a particular condition, you can just kind of flip it open and read to it, read what's associated with that. The other thing is, sometimes within a symptom-oriented treatment, asthma being a good example, is we can learn things that just improve quality of life, but maybe in situations where we don't have asthma, but it opens up the chest, it reduces bronchial spasms, it can help regulate the breath, it helps improve circulation to the brain. There's a lot of things that can come from even doing some treatments. If you have like a respiratory issue and you're not quite sure what it is, or it's short rapid breathing, if you kind of understand some of the conditions, it makes it easier to go through and treat. So, today we don't really have a format like we do with a lot of other classes. I have laid out a bunch of things for you guys, but we can also bounce around and just talk about some of the things you guys want to address. This book is always in process. Like, here are the respiratory notes are being presented. I still have a bunch more respiratory notes, but before I keep going down the rabbit hole, I want to see how you guys process this, and if I need to make adjustments before I do, a whole bunch more work and then go, oh, I should have done it different. So I thought we'd present you with a segment, but even things that we've gone through and done in the past, like the immune system and things like that, working on like the second version of it, where I took some of the things that you guys talked about and the concerns that you had, and we're trying to refine even that and do it in this format where there's a lot more education of explanations, causes, symptoms, things like this. So again, it just makes it easier for you guys to troubleshoot. And so, feedback is helpful. I'm trying to make something that works for you guys, not something that I want to do, but like something that really genuinely works for you guys. And so we'll go through and we'll do this and we'll see how this works. And then I'm going to be making notes throughout the day of how I can adjust this to help better serve you guys. So I'm not going to be lecturing like blow by blow. This condition is, I thought we'd look at it. You could read it a little bit if you want, if you're not interested or it doesn't really seem like to apply to you. But right off the bat, I give you a really super simplified explanation of the respiratory system so that we kind of have a basic understanding or a baseline to kind of come from. right? And so you can kind of go through and read that whenever you'd like, but let's jump to the next piece and let's just start talking about asthma. And yeah, we'll kind of go from there. And again, we'll be opening up to Q&A, and let's try to keep it to respiratory conditions today, but kind of anything goes. Okay. So again, asthma, there's different kinds of asthma. There's acute asthma, there's chronic asthma. Acute usually means something that's happening for less than 30 days in medical situations. Chronic is something that's lasted longer than 30 days. Then you have variations, like you have variations where a person might have asthma at a certain time of the year, but then other times of the year they don't, so that would be very allergy related. Then you have, I used to see this in athletes a lot, is exercise induced asthma. And what would happen is, it usually happened more in endurance athletes, but when they would be pushing, they would be fine. And then their body would just reach this point, be it fatigue or toxicity, whatever it might be. And then all of a sudden they would have a hard time breathing. And so the thing that I found back in the day for that was I would give them large dosages of fish oil. Like if I give them a bunch of fish oil, the exercise induced asthma would go away. But if I gave fish oil to a normal asthmatic, it didn't really do anything. And so, sometimes even within the condition, there's these like variables or variances. Now, if you're here just looking for things for yourself and how to improve yourself and maybe your family and friends, this might be a little bit interesting. If you're looking at being able to treat people, having clients, having people that, that have the condition, or, you're a therapist, hopefully this lays things out for you so that you're able to troubleshoot different kinds of variations or conditions. But a big factor for asthma is usually allergies. Allergies can do it. Even emotional things can cause issues associated with asthma. I've had several cases that like all the different like clinical treatments for asthma were done, and they would start to get a little bit better, and then it would stop. And so at first, you start looking, is it a paradoxical response, meaning that like their body is almost working opposite the way that it should be. There are some variations, like there's a vocal cord syndrome that can cause asthma-like symptoms, but a lot of times it was stress or trauma, like, a trauma from the past. And, if you think about when you want to access something in the unconscious, one of the best ways to do it is through the breath. And so like in meditation and doing mantra work and doing deep psychological work, you harness the breath to go deeper into the psyche or into the unconscious to access things that your mind is just not aware of, right? And so with this, sometimes the asthma is happening to keep the person from thinking about something very traumatic that has happened in the past. And they're not doing this on purpose, but sometimes what happens is the body tries to help you get through the moment. The body tries to help you to get through the day, right? And so what it does is it forms a really short-term strategy of like, if you don't breathe very deep and you breathe really rapid, you won't go deeper into the unconscious, so you can stay functional. And sometimes that actually can be necessary. If you're in the middle of a crisis or a critical situation, that you're not going deeper into what happened is good. But then when it becomes chronic, it becomes something that is causing your body to have issues, but it's also denying access to that to be processed. And so, if somebody presents with asthma, I always treat it just as straight up asthma. And then whatever problems kind of start to pop up, then I start to go through and look at what are the potentials. And one of the things that I really like about, even if a person doesn't have asthma, sometimes I treat people that do not have asthma, but I still treat them as if they have asthma, because you're unwinding the bronchioles, you're opening up the chest, you're deepening the breath, you're regulating the breath, you're improving circulation to the brain. And so that can diminish anxiety, that can diminish a lot of different things just by the treatment of asthma-like symptoms. And so even in spiritual practices, even in the chanting of mantra, this is going to sound funny, but even in the chanting of mantra, you can like lengthen the amount that you can chant, like going from Om to Om. You can lengthen the amount of time you can chant the mantra by basically treating the respiratory tract for asthma, because then your ability to inhale, hold your breath, and then let it out very slowly is what lengthens the mantra, and it's the difficulty that you have in asthma, right? And so you can look at some of these symptoms as ways of just, you could say prevention, but you're just improving the quality of a particular system of your overall health, and sometimes even emotional and mental contributions in this, by just treating the body as if something is happening, even if the symptom is not there. So if you go through and you look, there's different kind of explanations here about asthma and everything. And then it has the symptoms, the wheezing, the shortness of breath, a lot of consistent coughing, chest tightness, because you're having a hard time breathing, there can be a lot of chest tightness, because the muscles of the chest, there's like skeletal muscles that help elevate the rib cage in respiration, like when you're breathing. And when these areas have to work harder, it starts to cause tightness in the chest, and then a little bit of anxiety or almost panic can set in, right? And so there's these aspects of asthma that if you deepen the breath and you kind of treat all these symptoms, your respiratory tract feels really, really super good. You'll notice that your mind is clearer, and emotionally and mentally, the emotions tend to stabilize a little bit more. When the breath is shallow or rapid, it amplifies lower emotions, it amplifies stress, it amplifies the things going on around you that are potentially negative. So by going through and deepening the breath, slowing down the breath, strengthening the breath, you are deepening the higher emotions, your cognitive function, your ability to be present. All of these things are being addressed. And so rapid breathing as well. And so I kind of want to talk about asthma for a bit, because there's a lot of things here that can be helpful for other things other than just asthma. So if you look at first, there's the basic treatment, and there's a bunch of different oils. There's some blends. Here's the thing with asthma. When somebody is in a little bit of a crisis, their ability to smell essential oils might not be that great. So sometimes you have to go real gentle and then increase treatment as things start to calm down. So in this, we even put a little bit later different things that can augment the treatment, things that are not essential oil based that you can get from your health food store or, wherever, Amazon. And it just will help you troubleshoot things as best as possible. And then we even put in some psychological factors for this one. So again, here's a bunch of single oils that work really well. I want to talk about a couple of standouts here. One is we'll start with the single oils: hyssop decumbens, larch, and where is it? Amivisnaga. All are super good for asthma. Amivisnaga is especially good if there's a little bit of an emotional component to it. Could be stress, or could be, past trauma, could be that they're not responding to other treatments. And the Amivisnaga helps to reduce the spasms in the respiratory tract and the bronchioles, but it also has a component that allows some of the emotion to come out. And so with that, I want to be clear that like when the emotion is coming out, it's not necessarily like it comes up and you have to process it. We're talking about this from more of an energetic point of view. Like if you open up the respiratory tract in a way, it just allows you to go through and process it, or it allows you to go through and release it. It doesn't necessarily mean that you have to rehash the thing in the past. It just means that the traumatic energy, the effect on the physiology, all of that is diminished and released. It's a lot like, I use this analogy a lot. It's a lot like taking out the garbage. You don't necessarily go through the garbage and you go, okay, what did I do these last few days? Oh, there's that quart of ice cream, there's this, there's that, couple TV dinners, what was I doing? It doesn't make you rehash things like that. It's just, you just grab the bag and take it out. And a lot of times when you go through and you regulate the breath like this, you just start to release something, or it starts to transmute in the body and in the physiology. And so the more that you work this asthma aspect, the better your breathing usually gets, because the thing with asthma, it hits a lot of markers in the respiratory tract. It's a great way to do preventative treatments for any particular like respiratory kind of issues in times of stress and times of trauma, but also going into the cold and flu season. So we're talking about it like asthma, but really it's prevention, it's overall health, it's reducing the responses in times of allergies, things of this nature. So okay, so we have Amivisnaga, hyssop decumbens, very good for deepening the breath, very good for unwinding the bronchial spasms. If there's mucus, if tension in their tract, all of this kind of helps quite significantly. Larch, very similar. Larch has an impact also on if we're somaticizing, right? If something's going on that we would physicalize into our body, like if say for example, like when you were young, you had teachers that always just said, you're never going to do well in life, you're never going to do this, you're never going to do that, you're never going to make it. And then as you get older, it might be somebody that you looked up to. It's like, well, if I do good in life, this is very unconscious, but it's a very common one. It's either like you got programmed a little bit, or you don't want that person to be wrong because you looked up to them. So then you just go, well, this is what they said, I should probably do this. And then in times where you're breaking out of that box, you would then start to somaticize or physicalize whatever the issue is. And so It also can be when somebody is projecting a lot of hostility or negativity towards you, like people are getting aggressive towards you. Say you're in your job, you made a decision and 50 people got upset. There's the part where, they might be trash talking you or whatever, but there's also an energy that's projected that then your physiology has to deal with. The more that you reduce the somatic response like that, the psychosomatic response, the more that it diminishes what is being projected towards you. And I know I don't know that I've talked about it that way very often. It starts to get kind of technical. It starts to get kind of technical. And, I try to do things where I don't have you follow the bouncing ball through a whole bunch of things because, sometimes it's interesting and sometimes it's not. Just tell me the end result is kind of my attitude. It was like, just tell me how to treat it. But it's nice sometimes to backtrack and go, this is why we're doing some of these things, right? And you also have an experience to draw upon. And in that note, if that issue is a little bit of an issue for you, even in the angel work, there is the angel Sabriel. And it is actually for diminishing that somatic response. Personally, I use that angel quite often. Like this week, for example, I've used it pretty much every day. Like just in times of breaking out of the box, difficulties, somebody being upset at you, or you breaking out of one of your patterns, whatever it is, I tend to go right to the somatic things just because I don't want to physicalize. Like sometimes if I sit and search the themes, I'm like, everything seems good, but there's this little tiny feeling that feels like the other shoe's going to drop or I'm going to get in trouble or something. And I'm like, what's there to get in trouble about? But it's not rational. It's an unconscious, irrational thing that's just in the head. And it could be because of your upbringing or something bad happened to you or who knows why. Like sometimes it's important to understand why, and sometimes it's there and it needs to be addressed, right? Another one that I really like about this is spikenard can be very soothing to like slowing down a rapid rate, but the one that really slowing down rapid breathing, rapid breathing would be associated with anxiety, it would be associated with panic, it would be associated with like being triggered very easily. And the one that really works there is a lang lang. Lang lang, you just put like several drops, like I usually do it like across the ribs, or just below the ribs. And I mean, it literally like will just start slowing everything. You okay? Give us just a second, everyone. We'll get careful difficulty. Good. Okay. So did they hear everything that I
It
said?
was like the last minute was in the tunnel. It's very
Okay,
busy.
so now it's better. Okay, so the ylang-ylang helps to slow down the breath, so it will help reduce anxiety. It can potentially reduce fear, the tendency to be triggered. The other thing is, if you pay attention to yourself sometimes, like when you get really frustrated, frustration usually turns to anger, right? Eventually. It might not do it right off the bat, but eventually it turns to anger. And when you start getting frustrated, before that frustration converts to anger, you'll notice that your breath starts to go really rapid and get really shallow. And it's like frustration, and then you get triggered, and then boom, the anger will happen. And Lang Lang is one of the best things for that. You know, it slows down the breath, it diminishes the tendency to feel frustrated, and it is really good at minimizing the conversion of frustration into anger, right? Another one that I think is a good one to mention here is rosemary verbenin. And the reason why I want to mention rosemary verbenin is, you know, part of asthma, there's inflammation in the respiratory tract. Rosemary verbenin is very balancing to just like all the body systems. Like when you have something going on and you're not quite sure what's going on, and there's a lot of things that are getting kind of wacky or wonky, rosemary verbenin is a very good place to start. But rosemary, by its nature, helps increase circulation to the brain. Basically, it's what you call a cephalic. And a cephalic is basically, it moves blood to the brain. And the thing that happens with asthma is when somebody has short rapid breathing is you've reduced the amount of oxygen and blood to the brain. And so when it starts to become a little bit more extreme, it becomes a thing called hypoxia. And hypoxia just means your brain's not getting as much oxygen as it needs, right? And so, you know, we have these blends that are made for, you know, the bronchioles are for bronchial spasms, and the breathe easy is for inflammation and just opening up the chest. The pulmonary stress support is for when you've really had issues struggling because there's been a lot of mucus, a lot of allergies, there's been a cold or flu, and the system itself can become stressed. And when it becomes stressed, it just stops functioning like it should. And then the unconscious blend is heavy on the large, so it does have that you know, the effects on somaticizing in the body. Again, I like to use that one quite a bit. I find it very, very soothing. So when you're going through and you're looking at the initial phase of treatment or the initial unwinding of asthma, usually if the person's in crisis, you know, our logical mind would go, let's go to eucalyptus, let's go to peppermint, let's go to, you know, hyssop or something. They might not be in a good enough place to even inhale that, you know, like, so you just start unwinding this very, very slowly. So here you can see gentle inhalations with chamomile, with lavender, with mandarin. Now, the thing with mandarin, it's very antispasmodic, but, you know, if you have like tangerine or orange or something that seems very similar, they don't quite have the antispasmodic properties that mandarin does. So even though tangerine and mandarin seem very, very similar, in a lot of ways they are, in this way, they are not. So utilizing tangerine in this, not really super, I mean, it might help a little bit, but not like mandarin. And so even just something like lavender can be helpful. It can be soothing. It can relax the respiratory tract if there's nervous tension in the body. And then kind of the same with the Roman chamomile, very soothing, very anti-inflammatory, will hit the respiratory tract and just, there's inflammation, calm it down, still has some antispasmodic properties to it. The next, after a few days of treatment like that, you can start working in like clary sage, spikenard, tarragon. And here's the thing with tarragon is, you know, tarragon helps stimulate like rest and repair, right? So it does this by strengthening the aspect of the nervous system that's associated with rest and repair, known as the parasympathetic nervous system. And think about it like this, like when you see somebody get hiccups, right? It is a spasm that happens in the diaphragm, right? It's not like it's just cramping. I mean, there's a little bit of cramping, but sometimes it's something to do with the nervous system itself. And one of the best treatments for hiccups is the use of tarragon. be it either inhaled or taking a few drops internally. And so if you look at what that does for the diaphragm, if you're wanting to calm down and open up the nervous system to a higher degree, but if your respiratory tract is needing like a little bit of rehab, tarragon is a very good choice in with all these other things. You know, you're kind of wanting to do some of these things individually, but the tarragon helps to reduce the spasm in the diaphragm, but it also helps to calm down the neurological reason why those hiccups are happening. And so even if you're not having hiccups, if you think like, I would like to calm down my diaphragm or my nervous system, one of the ways to do that is through the diaphragm. Like you can lessen tension in the spine, and you can lessen like fight flight responses by the health of the diaphragm. And so by unwinding this aspect of the diaphragm, even if you don't have hiccups or even if you don't have asthma, it's a way to drastically change the nervous system and the responses in the involuntary part of the nervous system just by going through and doing simple treatments. Again, Lang Lang helps slow down the breath. I think we talked about that quite a bit. Rosemary verbena, helpful with the inflammation in the mucous membranes. And again, always increasing blood flow to the brain. Like it's always going to offset the things that happen with poor respiratory function. One thing that happens with really chronic asthma is there can start to be some brain fatigue. And one of the sages is actually always kind of good. Spanish sage can be used in a bigger dosage in this particular case, or just any of the regular sages. You know, you can just apply it to the body. You don't even necessarily have to inhale it, but just application to the body, like in a body tonic or a lotion, can be very helpful and beneficial. Frankincense is very interesting in this particular thing, because if there was a study done many years ago where if a person took a couple of drops of frankincense daily, they were less likely to be reactive to external factors. So basically, if you have a tendency to react to molds, or when everything is in bloom in the springtime, or, you know, whatever it is, you know, you're around people who smoke, and the cigarette smoke maybe makes you a little bit reactive, and your respiratory tract like go into a little bit of distress. Frankincense will help reduce the reaction, like in your body, in your physiology. And done over a period of time, it's cumulative. So if you're taking it for a week, it should reduce symptoms. But if you do it for a couple of months, it reduces the tendency of you to have those reactions substantially. Usually, not every time, but usually. And anise is good for what we call aerophagy, or gulping of the air. And you know, this is actually a little bit more of a digestive issue, but it impacts the respiratory tract, because you start breathing like abnormally, or abnormal rhythms. And the more that you calm down the stomach, it calms down the trachea and your swallowing mechanism. And so it's a way to further deepen and open up the chest. Before we get moving on, let's maybe start having some questions. You know, we're covering a lot of material. Not everything I'm going to lecture like this. I think asthma is like really important, because even if you don't have asthma and you treated yourself for asthma, usually your respiratory tract is pretty solid. Like it's good prevention. like a really super good prevention. So I kind of went a little deeper on asthma. Like, I don't know that you want to read these kind of notes about every little condition, but I have a crazy amount of notes, and sometimes I just have to figure in like what are the things you guys want to hear and what isn't. And so I thought this one was really important. So let's go ahead and open it up and let's hear your questions.
And you can raise your hand in the chat. Raise your hand, I mean, you can unmute yourself. You can type into the chat for any questions, just so you guys know how we kind of do this. I'm actually,
Greg?
go ahead, Denise, and then I'll.
Thank you. You said something about the brain and and so it would be Jared's father's had chronic asthma for many, many years.
Mhm.
And I have noticed the last few years his cognitive seems to
Yeah.
really be
Yeah,
slipping.
yeah.
Can you
Super
it would help-
normal with really chronic asthmatic condition.
really?
Yeah.
And since I was a few minutes late jumping on, you mentioned frankincense, but there was another one. I think Spanish sage.
Well, for like, so what you're looking at with asthma is, there's all these different aspects to asthma. And one of them is when you have short, rapid breathing, like even with anxiety, when you have short, rapid breathing, or when you have like really difficulty with breathing, or sometimes, even though you're taking in a breath, not all the oxygen is hitting because of inflammation in the respiratory tract, or, there's lots of different reasons. But the use of rosemary verbenin, for one, reduces the inflammation in the mucous membranes, which the respiratory tract is full of mucous membranes, right? So it helps to reduce that inflammation. It helps balance out the body. It's a good one to use to treat respiratory issues. But one of the great things about rosemary, especially rosemary verbenin, is that it increases the blood flow to the brain. And anytime you increase the blood flow to the brain, you're potentially detoxifying the brain, and you're getting more oxygen to the brain, and you're improving memory, cognitive functions. You're covering a lot of ground in just the use of the rosemary verbenin. And regular rosemary will do it, but the verbenin have found over the years a bit more effective. And so, like, if I didn't have rosemary verbenin and I had rosemary, I would use the rosemary. But if I was like, okay, I want to go top shelf in this treatment, I'd go rosemary verbenin. And it's not like it's more fancy, or it's just, it targets each of the different chemotypes of rosemary can potentially target slightly different things in the body because the chemistry is slightly different. It evolved differently in nature. And so they come from the same plant, but because of where they were or what was around them, they produce a little bit slightly different chemistry when they grow. And so when you go through and you analyze what is the difference between regular rosemary and rosemary verbenin, the chemistry, the chemicals that are present in each oil are different. And so the other thing that I like for something like that is I would also treat that as brain fatigue.
Okay.
And rosemary should help the brain fatigue somewhat, but one of the best things for brain fatigue is sage. And Spanish sage, you can do like a little bit bigger dosages than regular sage, just because regular sage has certain chemical components where you need to keep it within a certain amount of application, right? Spanish sage, you could go a little nuts with it and it will be okay. It doesn't quite have the same chemistry, but it has the same impact. And so it reduces the brain fatigue. But one of the best things about all the different sages, not clary sage, but just sages, is that they're neuroprotective. So they will reduce the fatigue in the brain, but they'll also potentially reduce damage that could happen to the brain or to the nervous system in either an acute way or long-term is, degenerative disorders that could happen with the brain or the nervous system. It potentially can slow that down. if a person's really predisposed, that it would stop it. I mean, I would hope for that, but like it being realistic, it would probably substantially slow that down. If a person's already way down the line, it would still help, but it might not, stop the onset of a particular neurological condition. So if the person has had chronic asthma for a long period of time, you want to kind of offset some of the symptoms. Of course, you want to treat the asthma, but, like you said, cognitive functions are going down. There's probably a little brain fatigue. Memory is probably floating away a little bit, like they don't quite have the cognitive functions or the memory functions to be able to recall things, especially like the short-term memory, because the short-term memory happens within about, I can't remember, it's like 60 or 90 seconds, and then it converts to long-term memory. But if that aspect that is associated with short-term memory is diminished, it's not really producing long-term memory because short-term memory didn't form anything. The rosemary, verbenin, and sage are a really good combination to treat issues with short-term memory. Sage in particular is really good for it, really super good for it. I mean, it's not just like, oh, clinically, this is what happens. I try to watch, like, over the years, there's been different studies, and one of the studies was treating short-term memory issues, which is, the beginning of the formation of the memory and what oils worked. And several oils kind of worked. Sage, out of all the essential oils, was the rock star. Like it really was the rock star. Rosemary gets blood, right? But the sage hits the neurological component. So you're kind of doing with the rosemary, verbenin, and the sage, you're hitting two different pieces. You're hitting blood supply and nerves. And with that, like when you think of regenerating something, there's different kinds of regeneration. And the regeneration that we usually think about is usually blood supply oriented. If you increase the blood supply, you're getting more oxygen to the area, you're getting nutrients, you're flushing out old stagnant blood, you're cleaning the area up. This helps to strengthen that area so that it can heal or regenerate. But there's a different kind of regeneration that is neurological. Neurological regeneration isn't the growing back of nerves, but it's improving how the nerves work in that area. And sometimes what happens is the nerves stopped functioning like they should, and they either kind of shut down a little bit, or they start doing different things, like things that are not necessarily helpful to your body. Sage will help re-educate the nerve to function more appropriately. And in this particular case with the brain, if things have become like dormant, like when you sit on your foot and it goes asleep, part of it is blood supply, but the nerve stopped working, right? Like, so your foot literally goes to sleep. That can happen in the brain. It can happen anywhere in your body, right? And so by increasing the use of sage, it's like it kind of wakes that up a little bit. In the digestive tract, we use different things. The ANS support, which is rosemary, verbenin, anise, and tarragon. It's stimulating the function of the nerves in the gut. But in the brain, you go kind of hard with the sage. And you can diffuse it. It can be topical. It doesn't mean that it has to be a bottle up to his nose. Like it could just be like a little body tonic that feels really good. It calms the body down. It's very strengthening. It's very toning, and will increase his energy levels. But the byproduct of it will still be that it hits the brain and makes the brain function more.
Is it also something they can take internally? Either of these? I have rosemary verbenin.
Rosemary verbenin definitely could take internally. I wouldn't take the sage internally. Topical or inhalation is best, but the thing with like regular sage is there's certain chemicals in there that the makeup of the sage, not the best to be taken internally. It can get toxic quickly. You still could take some, but usually, especially if it's people who are new or something like that, I usually don't have them do it.
Yeah.
Spanish sage is a little easier to do with that because it doesn't get that toxic issue isn't there. But I just don't like people to get confused, and I don't know that there's a big benefit of taking it internally versus topical or inhalation. And so you could just even set it up as a diffuser in the area, or you could put it on his feet, or have him rub it on his feet every day, or like a body tonic where he just kind of rubs it on his chest and his abdomen or his shoulders. Because the other benefit from sage is that it calms down the sensory nerves. And when we're young, we don't really think about this, but as we get older, we have to keep stepping up our game to reduce inflammation, because inflammation is literally the aging process. If you broke down and said, mechanically tell me what the aging process is, it's inflammation, and then what inflammation does to the body. It just starts breaking down tissue, and not real super fast, but little by little it starts to break things down. And so the byproduct of inflammation is your lymphatic system has to really work to kind of clean that up and flush that out. And even that, at some point, the lymphatic system gets a little overwhelmed. There can be, areas in the body where there's stagnation because of an old injury, a surgery, arthritis, whatever it is. But by the time it gets to this process, part of what happens is that the sensory nerves start to fire at a much more rapid rate throughout the body. When there's a lot of inflammation, or when there's a lot of lymphatic stagnation, the nerves fire like, this is just like symbolism. This isn't actual, but like, say it fires 5 times a minute, it'll start firing 50 times a minute. And so you see this is like things like chronic fatigue syndrome, fibromyalgia, those even post-traumatic stress disorder, the sensory nerves in the body are firing at a much more rapid rate. And so sometimes when people are having cognitive functions, they can't keep up with the processing of all the sensory information going to the brain. Just think if when you are having a conversation with somebody and somebody else is talking to you and you're like, I can't process this. And then think of it as like if 5 people were talking to you and then 10 people. That happens to the brain with all that sensory information coming from the body. And so putting the sage on the body, it strengthens the brain because of how it calms down the nervous system and the other parts of the body. Taking it internally actually doesn't quite hit that marker, but applying it topically or even just inhaling, because when you inhale, those molecules that you're smelling are getting into the lung tissue, and then as blood passes through, it starts spreading it through the whole body, and then it starts calming down those sensory nerves. And so by going through and doing this, I mean, usually you feel better, you feel stronger, you feel a little bit more relaxed, your head feels a little clearer, it reduces the brain fatigue. It's just, I mean, I have a bottle of sage here on my desk when I'm teaching. I have one out where I sit every night. Like when I sit at the end of the day, there's a bottle there, and there's one in the bedroom by my bed. Wow. I use sage every day. I use basil every day. Like, there's several things that are just like going to use it no matter what. And if all of a sudden I'm like, my head's like going, I'm just having a hard time processing it, I'll think about it. And I was like, I haven't used sage for a couple of days. So even stress will impact the nervous system in this way. So the sage kind of reduces the impact of the stress, but it definitely calms down the nerves from the stress or from the trauma or from the difficulty. because sometimes it's not necessarily that you're trying to offset like a bad thing that happened in the day. Sometimes something good might be happening, but it's a lot of details, right? You know, or you're shifting, or you're having to change, you're having to talk to a bunch of people. All of that still hits the nervous system the same. You know what I mean? Your nervous system doesn't go, this is good, this is bad. It's just information, information, information. And it doesn't really, to the nervous system, doesn't really good or bad. It's just, it has to take it in to adjust to the environment. And when there's a lot, at some point, the brain just goes, I'm done. I need a break. I need a cigarette break. I need to go outside for 15 minutes and like sit and just chill on my fingernails and rock. You know, it just starts shutting down a little bit. And so Sage is a way to prevent that from happening.
This is excellent, excellent information. Thank you so much. And it does help me understand him a lot better and what's
Yeah.
kind of going on.
Yeah.
Okay.
I mean, that's the thing too, is like some of these issues with the respiratory tract can start to not just produce like negative emotions and cognitive abilities. If it's there long enough, it will change their behaviors. Like I mean, it really will. And so sometimes you're not really talking to the person you used to know. You're kind of talking to the physiology that was associated with them. You know what I mean? Like, especially when somebody gets older, if there's a big physiological issue, sometimes that's what you're interacting with, not the personality that you used to know. And so, you know, you can help them like maybe get out of that, but you know, even if they can't get out of it, maybe you can calm them down just so they feel like they're in a better place. And the other issue too, like with something like this, they might not cooperate.
Yeah.
So
But
my thing that I
diffusing
do,
helps.
yeah,
Diffusing might help.
diffusing helps. And sometimes, like if you're around them a lot, I do this little trick with my family sometimes is you know, they know I do essential oils and everything, but they're all like, you know, we're from different tribes. I'm not sure if I was adopted or not, but it kind of feels that way sometimes. And so what I do is I put like 5-6 drops of whatever I want to do on my wrist. I rub it together, and then if they're standing there talking to me, they have to inhale it.
I love that.
Sorry. And they go, oh, what's that smell? And they go, yeah, you know, that stuff I'm into.
That's excellent. That's so wonderful. Wait, now, and I saw a question come across real quick, and I want to know too. So I've got Spanish sage and I've got definitely the rosemary verbena, but people were saying, what's your favorite sage? And I really want to know too, or your favorite ones. I mean,
well, it depends. Like my all-time favorite sage is Blue Mountain sage. Like I love me some Blue Mountain sage. It would work here too, but it's a little pricey, you know, for what it is. And for treatment, like the thing that I put on every day, I just put on Spanish sage. Like I'm just putting on Spanish sage daily because I want to do big dosages. And so, you know, I usually put like 6-8 drops on my wrist and like rub it together. And Spanish sage is very good for like intense treatment over a long period of time. You know, the Blue Mountain sage, I don't know that I'd treat it like that, you know, for one, cost, but also, you know, it has a little bit more of some esoteric things that the other ones aren't as strong in. And so when I'm looking for just bread and butter, like treating the body, the brain, the mind, you know, for me, I want to keep the nervous system calmed down, because sage is also balancing to the autonomic nervous system. The difference between fight, flight, and rest and repair, sage helps to balance that. So it helps to offset the aspects of the stress. And the other thing that's nice about sage, very fortifying to the adrenals. And so if your adrenals are a little bit depleted, they've been worked, you've been stressed out, you've been in fight flight for a while, it keeps them from being so overreactive, and it strengthens them so that you're not just depleted, you know, because one of the big things that overactivates adrenals is fatigue. And it's not necessarily like stress and everything like that. You get a little tired, you get a little worn down. You're still trying to push and, drink that cup of coffee or whatever, but your body goes, well, you need a little more energy. Let's do a low grade release of some adrenaline. And then that works for a while, but you didn't really get enough rest. And they were like, well, let's increase the dosage. And then pretty soon you're kind of in fight flight, because little by little, the body said, let's keep increasing the adrenaline running through your body.
Thank you, Greg.
Yeah.
This was excellent. Thank you. I
Oh,
appreciate
you're
it.
so welcome. Yeah.
And go ahead, Ralph.
Hey, Ralph.
Hey, Greg, congratulations on getting your book out.
Oh, thank you.
Let's see, you had mentioned that you were using frankincense
Yes.
for, what was it?
If
To reduce
you
reactivity.
reduce reactivity to the environment, not
Right.
necessarily like emotional reactivity, like if you have your Uncle Bob and every time he walks in the room and says some,
Mhm.
scathing little thing, you get triggered. It might help with that. But I find that things like spikenard or something like that is more helpful, like with that, like spikenard, vetiver, valerian, things, even dark
Yeah.
blue tansy.
Mhm.
But when you're talking about reactivity to, pollen, another one is change of weather. Here's the thing that I've always found a little bit interesting. I remember when I first realized this and then talked it out with a doctor friend of mine. You can be allergic to extremes in temperature. Like you can be allergic to the cold, you can be allergic to heat. And so when you start to experience like a lot of heat or a lot of cold, all of a sudden you start to have like allergic type responses.
Yeah.
Some of that is just how your body has been trained, like, I don't want to be cold or I don't want to be hot. And so it starts going into like an allergic kind of response. And so I have this funny little thing, like in the morning, about 5-6 o'clock, I'll get up and go pee or something. And if my feet get cold, I have a sneezing attack. So I either cover my feet up really quick or wear socks. But, it's like 3 or 4 sneezes, but it's because my feet got a chill and
Mhm.
it happens. And, you would think that I would take frankincense to knock that out. Now that I'm thinking that out, it's like, why am I not doing that? Oh, well.
Okay.
But anyway.
All right.
Any-
Second half of
even-
second half of the question.
Uh-huh.
Okay, frankincense works for all this magic stuff. How does Three Wise Men, the blend Three Wise Men, also function for this?
It
Or
probably would. I mean, it's, that's several kinds of frankincense and a couple of different kinds of myrrh.
yeah,
You are with Three Wise Men, that one's going to be coming up quite a bit tomorrow because it jumpstarts all the endocrine system.
Yep.
That probably will still work that way. Like, I don't know that you need to take frankincense by itself. Like, I wouldn't make it too complicated of a blend, but
Mhm.
the thing with myrrh is that it makes you less, it reduces your response to pain.
Right.
So you have your response to pain with myrrh and then the response to external triggers. I think that combination could be fine. The study that I'm referring to, they studied several different plants, but the one that came out as like, this is the go-to thing was frankincense.
Okay. The reason I
didn't
ask
test
is
blends.
because, both Claire and I have the weather change going on. We both notice that. And it shows up in, a little bit of sneezing or nose runny.
Yeah.
So that's why I'm asking if we're
Try
already doing Three Wise Men, do we need to
try
add
doing
more frankincense?
Try doing the Three Wise Men and see how that handles. And if not, maybe just switch and just do frankincense. But you have the Three Wise Men. I would work that one for a little bit.
Okay. All right.
Plus,
Excellent.
it does all the stuff for the glands. It's anti-inflammatory. I mean,
Yeah, it's sort of my magic bullet at the moment.
personally, it's my magic bullet. Like, there's
Mhm.
Greg not on Three Wise Men, and then there's Greg on Three Wise Men, and
Yeah.
the Greg on Three Wise Men is a better person.
Okay.
Like I just,
Okay.
I feel better. I'm a little happier. I'm a little bit more motivated. If you ask me to do something, I'll like jump off the couch. If I'm not taking it for a while and somebody asks me to do something, I'm like, I need to know all the information before I get up. I just don't have the pep in my step.
Yep.
You know what I mean?
Okay.
And so I think it should work.
Okay.
In theory. Usually I've just used frankincense by itself, but I hadn't thought about using three wise men, but in my mind it makes sense. But that's in my mind. Let's see what reality
I'll
says.
volunteer to be your lab rat on this one and keep you
Perfect.
posted.
Yeah, and give us some feedback so we know.
Oh yeah, you'll hear.
Yeah. Okay, good. Good.
Thanks.
And then we do have questions in the chat as well. Guys, I'm gonna start from the top and move my way down, but if you want to raise your hand or unmute yourself in between, please feel free to do that. Even though people can't smell the oil, is it still having an effect?
Yes. So the thing is like sometimes the nerves in the nose, like it still gets the impulse to the brain, but sometimes it can't sense what it is. This can happen like recently, it's COVID, but usually it would be chronic inflammation, chronic sinus infections, a really bad sinus infection, or affection in the respiratory tract would make the sense of smell go away, or constant exposure to something. So it's still getting to the brain, but part of how it works is when you smell, those particles that you're smelling are actual particles of the oil that go into the respiratory tract and kind of land in the tissue. And then as the blood passes through, it hits your bloodstream. And so that's not dependent if your brain is able to process the smell. It's getting into your physiology, but also, even though a person can't smell, it just means they can't be as dependent on it for like evaluating something, like, is this milk bad or not? And you smell it, you can't tell. But the sense of smell also helps to shift the brain, the thought processes, and sometimes even the behavior, be it things in the environment or like, you're in your house and you smell smoke. All of a sudden you start thinking differently and you start taking action, like, I have to check to see what this is, right? It's tied to that sense of smell. That aspect still will actually work. The changing of thoughts, the changing of behavior, but you might not smell something. We have several students who do the classes who have very profound experiences, and they don't smell the oils. Like sometimes that sense of smell comes back. Sometimes it got damaged enough to where it doesn't. Basil usually is helpful in restoring the sense of smell, but COVID, several people lost the sense of smell or taste, and it didn't come back right off the bat. Basil is usually the way you would treat it, but COVID threw a lot of curveballs. So I think we're still trying to process and understand the long-term effects of some of these things. So.
And somebody actually had responded as well, one of the students, and said, I couldn't smell during one of the classes, and it was like had a huge effect.
Right. Oh, good.
Yeah.
Good.
You had talked about fish oil, and you said lots of fish oil. How much is a lot of fish oil to you?
For me, it was usually how big their body weight, but they were in crisis. So how there's those big capsules of the fish oil. I would usually give them 2 or 3. If a person was really like tall or large or something, I might bump it up more. But you also don't want to cause like diarrhea or something. So I would say give them a couple, and then like in a couple hours do a little bit more and just see if that resolves it. Usually the introduction of the fish oil knocks it out kind of quickly. There was this one case where it was a female athlete, and I mean she was a rock star. She did not have issues like this, but they would perform over several days. And, by about the third or fourth day on a long day, she would come back to the van and she would just be like, having almost like an asthma attack. And I didn't even give her the capsule. I cut the top off and I just squirted it down her mouth, and I had her just be still. And I think I put something over her eyes just so she wouldn't get super overstimulated by that. And she calmed down in like 15, like her breathing normalized in about 15 minutes. And, we did some treatments later that day for asthma. In the Chinese medicine, they do the cups. So I opened up the upper back and, did some healing on her and had her inhale a bunch of oils. Next day, she was fine. She said normally that would have taken her out of the competition. She had a bad 20 minutes. And so the oil that I used was, I started with mandarin, and I went right to a ylang. And then by the end of the day and by the morning, I had her using hyssop decumbens. And so, like right before she would perform, I would take like paper towels. I'm trying to think. Like I would take like a paper towel, like say this is a paper towel, it's just a piece of paper, but I would roll it so that it looked kind of like this, like it's open in the middle, but it just looks like a little tube. And then I would put some hyssop on there, and then I'd have her put it in her nose like this, and then just take long, slow, deep breaths. And it's even a little bit stronger than doing it from the bottle. And that's how we'd start out the day. And yeah, she said normally it would knock her out of competition. And I gave her my bottle of hyssop decumbens that I was traveling with. And every once in a while I would get a call from her, like I needed another bottle of that stuff. And she said she managed it between the fish oil and that. She never really had the issue anymore.
Nice. Earlier, you were talking about Ami Visnaga. Does it also help with snoring?
Probably not. Snoring's a tough one. I've never found a great treatment with essential oils or herbs or anything like that. Yeah, I don't have a great answer there. There are these little devices, like these little like bands that you put on your finger. I've heard people say that have gotten good results with, but I've never found anything consistently that has helped. It can help to diminish somewhat, but it doesn't necessarily make it go away. The other thing that I would say with snoring, sometimes this is going to be like an odd connection. It's not always the case, but fatigue can increase snoring. And you could be functioning and not realize how tired you are. Because if you think about it, like you're fatigued, so everything's having to work harder, you're running on a little bit of adrenaline, but part of what's happening is the neck and the neck muscles are constricting because you're breathing more rapid and you're having to pull your chest up more. They're having to work harder. And so the space in the neck and the throat actually gets smaller. And so it becomes easier to snore. And so whenever somebody would present with a lot of snoring, I would always look at the fatigue levels and the torso and the neck to see if that's wound up. And if so, I would go through and address it.
Could Greg repeat where he placed Lang Lang?
Yeah, this is the cool thing about the Lang with this, it kind of doesn't matter. But in my brain, like, because I'm wanting to deepen and slow down the breath, and I put it at the bottom of the ribs or the upper part of the abdomen, just because that's where the diaphragm is. And I'm thinking, like, I want to get that Lang to the bone in that area. You could put it on your feet and it would still do the same thing. But in my brain, like, I don't want to be like, did I use enough? Is it working? I don't know. Maybe it was too far away. You know, your brain starts, or at least my brain starts doing all kinds of weird things. So I put it on the upper abdomen or the lower part of the rib cage. But you could probably get away with just putting it on the wrist, but that's me.
Go ahead, Ralph.
Hey, Ralph.
Hey, you had mentioned Ame Vishnaga
Mhm.
for opening up the respiratory tract.
Mhm.
I just looked at the web page,
Mhm.
and I noticed Breathe Easy also contains Ame Vishnaga.
Yeah.
Is
That's what
is,
that's for.
is Breathe Easy a B choice for that one?
That would still be an A choice. Yeah.
Okay.
Yeah, like sometimes with this, like you know, I want to do things that like anybody could use. And so like, you know, I don't mention blends in these notes too often because I don't
Mhm.
want it to I don't want it to turn into like a thing where I'm just like marketing my blends and things. I just want you guys
Right.
to be able to treat things. But breathe easy is an A choice. Like it is
Okay.
totally an A's choice. Yeah.
Excellent.
But
Thank you.
you know, we have some people that are from other companies that kind of come in and look at this stuff. So I'm going to
Mhm.
make this universal for everybody. Like
Okay.
it doesn't matter. Yeah.
Excellent. Thank you.
How do you use rosemary verbena? Like, what is the application?
For this, you could probably get away with inhalation, but for this, I would probably put a couple drops in water and drink it. Inhalation definitely works well. Topical works well. Topical, I would probably keep up in the chest area or like up on the neck. Very good for the sinuses, very good for the respiratory tract, incredibly good for the mucous membranes. Can help reduce mucus, can help reduce the production of mucus. Balancing to the body, you know, not just the nervous system, but just when systems start getting out of whack, it just helps to establish a better sense of balance within the body. And so, you know, I've taken like salt baths with it and really felt like pretty crappy, and then took a salt bath and I was like, why am I not doing this all the time? Just like the frankincense, like Ralph said, like, why am I not taking frankincense daily? But you know, you get so many things going on, like me sneezing in the morning because my feet get cold, not on high on my list of like, I have to address this, right? But rosemary verbena is good to use for prevention. It's good to use in the middle of being in whatever the crisis is, in these respiratory issues, and it's also good after the fact to help unwind some of the effects of the symptoms. So
Are the sinuses part of the asthmatic condition? My sinuses have been really inflamed and I can't seem to find the solution.
well, that's a very interesting question because it can be, but anytime where the sinuses are really blocked, even though you might not have asthma, you're having almost like very similar effects as you would with asthma because it's hard to get air in. You're having to strain way more to get something in. And because of all the extra effort to elevate the rib cage and take a deep breath and then push the air out, it can throw in some bronchial spasms as well. And so I would say if you had asthma or didn't have asthma, but you had chronic sinus issues, especially with a lot of mucus, I would treat it as if, because it's going to help no matter what. And that you clinically have asthma versus that you just have some respiratory difficulties, it's going to help no matter what. And so, I mean, really, until you start getting into like infections and bronchitis and pneumonia and things like this, you could almost always just go, okay, I'm going to treat sinus issues and I'm going to treat asthma. That knocks out a lot of things in the respiratory tract, because if you do both of those well, you kind of have covered, 80 or 90% of potential issues there. And so it's kind of a go-to thing to do. when it comes to respiratory issues. So I would just treat it as if, you know.
Will we be addressing COPD? Wondering if a question appropriate now.
I can't remember if I put COPD in here. I don't know that I did. Yeah, maybe a little bit later in the day we'll talk about it, even if I didn't put it in the notes. That's a little bit of a harder one to treat. You know, you can do treatments. Emphysema is the hardest. I didn't put emphysema in. I don't think I did. Maybe I did. But emphysema is really hard because when you increase oxygen levels, it actually can make the emphysema worse. And so you have to be really super careful about treating emphysema. COPD is complicated, but you can treat it a little bit like asthma, especially that initial phase that we've just talked about. You could just, you know, like the thing with the Roman chamomile and the lavender and the mandarin. The difficulty here is that the tendency is for the COPD to be very, very reactive. So I guess we're going to talk about it now because I'm just starting to. So the tendency is I do usually give somebody with COPD frankincense daily. Sometimes I have them take it twice daily. And then I start with just this initial phase of treatment. And instead of sometimes just gently inhaling like that first part on the top of page 2, Roman chamomile, lavender, mandarin, sometimes I don't even have them inhale it. Sometimes we start like with a body tonic and we just start putting it on like the legs and the feet and then kind of work up to the chest. And then eventually I have them start doing it. I just go really super slow. Yeah. If I didn't put it in, maybe I can dig up at some point and maybe get it into the notes this weekend. And if not, I can send it out later. You know, I'm always going to update this booklet. And so, yeah. So anyway.
How much sage do you use? Like, what is too much for brain fatigue?
If you're using Spanish sage, I would do 6-8 drops like on the wrist or in like, you know, a little bit of ointment or body tonic. If you're using, I mean, you could actually do that with regular sage, but I wouldn't do more with regular sage. Spanish sage, if a person like is in a chronic fatigue syndrome or fibromyalgia crisis, I make a super strong liniment body tonic and have them just rub it all over the body. And I'm probably giving them like about 15 drops in that application. And that's to pull them out of the crisis. And so the Spanish sage, you could really like double up or even a little bit more. But the other sages, I'd be a little bit hesitant, you know. I mean, if you overdid it, it wouldn't be too big of a deal. But if you did it consistently over a period of time, it could maybe cause a little bit of a reactionary issue. Yeah.
Can you put rosemary, verbena, and sage together in a diffuser?
I would rotate them. You could, but when you start mixing something together, sometimes they become different things. And, you know, I did try something like that. And what that starts to do is it actually just starts to target the adrenals. It doesn't really hit the respiratory stuff that we're talking about here. It kind of turns into this like adrenal tonic that I mean, which is good, but it doesn't necessarily address the issues that we're trying to address. Good question.
I don't know how many times I've heard this about sage, but it's landing differently today. I'm off to find my sage. We already asked that. What about unwinding / resetting this after it's a long-standing chronic issue? If the breathing has been off a long time and there's nerve issues.
Yeah, I mean, I would start with the top of page 2 and just start slowly going through this. And, you know, we're going to talk about like different phases to treat asthma. And then at the bottom of the notes for asthma, I even talked about like some supplements. I think I did. Like I'm saying this, maybe yeah, there's some things for psychological factors. And then there's other support down about halfway down page 2, other things to augment. Let's just drop down there right now. We'll come back and we'll treat it. But one of the big ones, especially if it's allergy related, is quercetin. And quercetin is a crude form of vitamin C. So your body processes it different than vitamin C, that like the pure vitamin C you get at the drugstore or something. That vitamin C passes through your system in about 4 hours, sometimes even a little less. Like, in your body doesn't store vitamin C, and it doesn't create vitamin C. So you constantly have to be taking in vitamin C. 90% of asthmatics have a vitamin C deficiency. Like, there is some sort of deficiency for whatever reason. So the regular use of quercetin, and I put the dosage down 50, I should have put milligrams. I left milligram off. 1,500 to 3,000 milligrams taken daily can be very helpful. Not 1,500 tablets, 1,500 milligrams. Boy, that's a big typo. Yeah. But if it's been really chronic, start gentle, and then you don't want to hit asthma hard. You want to just gently work your way into treating it, and then as it unwinds, you keep unwinding it. So if there's psychological things that come up, if there's changes or shifts in the physiology, everything is you're changing a little bit, and then you're adapting, and you're changing a little bit, and you're adapting. So slow is good in the treatment of asthma.
Someone said, like, your sensitivity to the cold, theirs is heat.
Mhm.
They get vasculitis in the inner lower legs and tachycardia.
Ooh, tachycardia. I still would take frankincense, and for the tachycardia, I would take either Melissa, Neroli might work, Lang Lang might work. I would say Melissa or Lang Lang. If you had Neroli, you could try that too, but the combination should calm some of that down. Yeah, it could be either one. It could be extreme heat. For me, it's either extreme. Like, I used to be able to be out in the sun, like blazing sun, and didn't bother me. But now I'm out in the sun where it's a lot of direct sunlight, and it's not even the heat, it's just the direct sun. I don't feel good. Like, it does not make the body feel good. So, it's still kind of tied to that mechanism a little bit.
I do not remember any respiratory infections. Would heavy smoking cause a lack of sense of smell?
Yes, smoking could do it, sure.
Which type of basil would Greg recommend?
Just the basic basil. Just good old-fashioned basil.
You said everyday sage. Is that Spanish sage?
Yeah, Spanish sage. Yeah.
Rosemary, verbena, been a daily dose. What would that daily dose be?
Like 2 or 3 drops taken internally, or if you're putting on topically, maybe 4 or 5 drops, like in a lotion or a little bit of alcohol rubbed on the chest or abdomen, somewhere in there.
I think you might have already answered that. The everyday use of basil is for what reason?
Reduces the effects of stress. It's an antispasmodic, and it stimulates mental function. I mean, it does other things too, but I mean, the reason I'm doing it is for cognitive ability.
What is in Sinus Health Blend?
It's, let me look it up because I don't remember. I know it's rosemary, verbena, but I don't remember what else. Give me just a second, I'll tell you. Mm. Rosemary verbena, hyssop, galbanum, eucalyptus, frankincense, basil, and marjoram.
I shorthanded it, guys, so I could get it typed in there. I'm happy to write it out more later. What about advanced phase mean?
Yeah, we're going to still talk about intermediate and advanced. So I was just stopping to take questions with where we were at.
Is that part of the successive treatment?
Yeah.
Or-
Yeah. Like you would start with the initial phase of treatment, and then as you know, we're talking more chronic, but and then you'd go to the intermediate phase, and then you would get into the advances, like when you're really going at it hard. So we're going to talk through all the pieces. So
Can you put basil on meat?
you can, like some people say it gets a little tingly on the skin. I put it on meat all the time and I never feel anything, but yeah, if you're not sure, you know, you could do it in a roller ball or just put like a little tiny bit of lotion or jojoba and then mix it and then rub it on. I do it all the time. It's fine for me, but you'll have to test your skin. Yeah. So how about this? We've been going for an hour and a half. We'll take a 15-minute break and we'll come back and we'll continue with asthma. We're not done with this conversation. So. Okay, everybody, do we have any more questions or?
Yeah, we had one that just came in. I'm new to this class,
Mhm.
wondering if all questions or is there an agenda and oils I need to have ready for the process or any process?
I'd say the agenda for the day is just kind of answering your guys' questions, and we will probably do a process at some point. You know, with this one, we're going to do a process that actually is not even going to involve using an oil. You know, we're going to do a breathing process, but you know, there's not really like a set thing like we're going to do this protocol. We're going to talk things out and we might do little experiments and things like that. You know, with something like this is more like an educational thing. Yeah, it would be hard to coordinate everybody. You know, we'd have to give everybody like a production list. And this is just more of like information for you guys to access when you're trying to go through and utilize something. And you know, we have a lot of classes that we're always doing, and sometimes you walk away with an oil and you're like, I have this oil, but I don't know really what it does. Part of these things with these class conditions is educating people on the different kinds of applications, because how it was utilized in a class might not be the only thing that it does. And so, you know, it just helps to explore the different components of oils in all the different applications. And so
I was diagnosed with COPD from volcanic smog bog from living in Kona, Hawaii.
Yep.
I had
Oh, my.
flu-like symptoms with body aches and brain fog, and my parents smoked in our house.
yeah, the VOG on the Big Island there, that's pretty substantial. Like I spent several weeks on the Big Island way back in the day when I was traveling with the medicine man. And that thing with the VOG it's a real thing. You know, at first people would tell me that I was like, sounds made up. And after a couple of days, I was like, what's going on? Yeah. The frankincense should help. And then treat yourself like this with the asthma stuff. You know, you don't necessarily have to do it all, but going through and treating some of the impact on the respiratory impact. The other thing that I would suggest is, we've been doing these free series on the lymphatic system, lymphatic techniques. And I would explore some lymphatic work with that. And, because there's the chemicals that are in the volcanic, whatever you want to call it, smoke or odors that come out, there's just gases and things. And so I would do a bit of detoxification. At the time when I was there, we were doing sweat lodges. And so I got over it kind of quick because of the purification of the sweat lodges. But part of what sweat lodges do also stimulate lymphatic function. And so I would try to duplicate that with some of that work. Yeah.
Any of the lymphatic classes? You've taught 3 so far. There's a 4th one in a couple.
I would jump in, because they're all covering different aspects of them. So, I'd jump in. If you really want to be thorough, start with number 1 and work your way through. But, you could look at them, they're all free, and look at them and see what oils you have to do, whichever one, and then just kind of dive in.
And I'll get you a link for that.
Yeah,
So
yeah.
it's easy for you to find.
Yeah. Okay. So we are mid-page on page 2. So when you're looking at treating chronic asthma, or you just wanting to do prevention, it's always good to start with the initial phase. And then eventually, after a few days, a few weeks, you go now to the intermediate phase. This is where the phases get a little bit stronger and not as complicated, because at first you're having to be really sensitive to what issues the person might be having as far as their reactive nature to the environment. But once you really kind of get into this, you can go a bit stronger. I would say the you see here the Eucalyptus radiata, hyssop decumbens, larch, ravensara. All of these are pretty solid. Now, here's the thing. I want to talk about eucalyptus for a little bit. Eucalyptus radiata, very good antiviral, for one. Very, very good antiviral. Very good. Any of the eucalyptuses are good about opening up the chest and opening up the lungs, lung expansion, expectorant qualities. But Eucalyptus radiata, as far as the scent is concerned, the fragrance of it is not quite as harsh as what normal eucalyptus is. Normal eucalyptus is known as Eucalyptus globulus. And Eucalyptus globulus can be a little bit harder for asthmatics to process. And it's very good for what it does. Just saying, for asthmatics, sometimes it's a little much. Really, even for somebody who doesn't have asthma, if you put a bunch of 5-6 drops on in a little lotion and rubbed it right here, like on your chest with the Eucalyptus globulus, it actually wouldn't probably deepen your breath. It would probably make your breath more shallow because it's so strong that it's almost a little overwhelming to the lungs. And so I tend not to use Eucalyptus globulus for asthmatics. If you do want to use it, you put it more down, like on the abdomen, like in the solar plexus area, or between the shoulder blades. You could diffuse it in the air, but radiata is so much more easily tolerated by an asthmatic than Eucalyptus globulus that I go radiata with this. And so if you are going to use a eucalyptus, check, but the globulus is real strong. You don't want to use globulus on an asthmatic or children. It's just too overwhelming. One that it's not necessarily an A choice here, but it is softer. So I didn't list it, but you could use as myrtle, either myrtle or green myrtle would be softer and could be more well tolerated, but Hyssop decumbens and larch are kind of a go-to thing in the intermediate phase. Ralph brought up the breathe easy and bronchioles. Those could be used here as well, but most times I was trying to keep things with single oils just to keep things as practical for you guys as possible. But I still might go through and add the blends, but I want anybody to be able to grab this booklet and be able to start performing, like, not necessarily having to have the blends that I make. And so single oils work really, really well when used like accurately, or when you really match up what the condition is. And here again, I'm suggesting Lang Lang simply because with an asthmatic, you're constantly wanting to slow down the breath. You're constantly wanting to reduce the rate of respiration. Like asthmatics tend to breathe more shallow and a lot more rapid. And so as you're opening up the chest might be opening, but that rapid thing is still there. And, because it's tied to like neurological function. So you just keep bringing down the respiratory rate, keep bringing it down, bringing it down, bringing it down. It gives a sense of well-being, it calms the emotions, it clears up the mind, but it makes it easier and easier to take long, slow, deep breaths. It makes it easier to hold your breath. It makes it easier for the exhalation. All of that. And now advanced phase, most times people don't get to this part. By the time they hit the intermediate phase treatment, they're usually doing well enough to where they kind of stop thinking about it. But if you wanted, these oils are very strong, they're very potent. They're not necessarily something you want to take super long term, but short term, from time to time, just to really reduce the onset of the asthma, is use either oregano or savory, which smells a lot like oregano. And you'll put 1 to 2 drops in water, and I would say a lot of water. Both of them are kind of hot. Like it will even probably make your lips tingle a little bit. One of the ways around it is to take like a little capsule, put a little bit of like olive oil in it or something, and then a drop, and then close it up. Originally, when I was taught, we would put it on like a little piece of bread and then roll it up in a ball and eat it. Or the guy who was teaching me, and for the love of me, I cannot remember his name. He was a French guy, but he was big on putting a drop of whatever oil you wanted on a sugar cube and then putting it in your mouth and sucking on the sugar cube, which I usually just crunched. And I kind of like the bread, and then I went to the capsules, and then I just went to the water thing. And so, different practitioners have their different thing. I'm not saying one's better than the other, but if I'm taking internal, I want to spend a bunch of time setting everything up. I just a couple drops of water and I drink it and I'm done. And so oregano and savory can be very helpful, but they are hot, they are a little tingly, and I would say people who are sensitive, like if you don't add enough water, you'll start to feel a little bit of weirdness down around the belly button, like the lower intestinal area, the small intestine. And so if you're doing that, just keep adding more water to it as you take it internally. So let's jump to the psychological factors, emotional support. So tarragon is used a lot. It's very soothing in times where you're maybe getting stressed or agitated, you got a little triggered, something happened, there was some vent where you're starting to have maybe a little bit of an emotional thing, but there also your breath starts to get all fluctuate, it starts to fluctuate quite a bit. And so, a lot of times lower emotions will directly correspond to respiratory function. Again, it's how you access some of the unconscious. And so you want to just be able to calm things down. So in those times where you're getting a little triggered, tarragon or bergamot can be helpful. The tarragon is very, very soothing. Like it kind of calms you down. It takes you out of that little bit of shock that happens. Like, you know, somebody comes in and tells you a horrible news, or you get into an argument with somebody, or there's even tension with somebody, say at work or in the family, there's a bit of tension. Honestly, I even put a little bit of tarragon on the soles of my feet after meditation, and it's just like, oh God, it's just so soothing. I mean, it's just so soothing. And remember, tarragon, good for the digestive tract as well, good for the diaphragm, very good for balancing out the involuntary part of your nervous system. Very, very good for that. Bergamot is very good for stabilizing and balancing the emotions. And again, we think of emotions as something just that we feel or something that we think, but emotions, there's a good amount of emotions that start from your physiology. You know, your physiology uses lower emotions to motivate you to take action in the environment to thrive. So there's a threat, you're going to get hurt, even abandonment is really more physiological than it is psychological. And like if you don't fit in the pack, it's going to be harder for you to survive, or it feels like you're dying or something like that. A lot of that is really primal programming in your physiology that kept people alive in nature, in the wilderness, but in modern day world, it doesn't quite always match what you're feeling doesn't match what's happening in the external environment, but you're still wired that way. So it's a way to kind of calm these things down. Bergamot is very balancing to the emotions. Like it just is very, like, balancing is not the right word, but it is balancing. It's more stabilizing. Like it's very stabilizing to the emotions, the lower emotions. Then you could use the blue healer, which is a blend. It's German chamomile, yarrow, milfoil, which is a type of yarrow, dark blue tansy, the regular blue tansy, Cape chamomile, Roman chamomile, blue cypress. That's all the blue oils. And there's some other things in there as well, but the blue has a chemical in it that makes it blue that is called azulene. And azulene is very calming, it's very soothing, and it's super, super, super anti-inflammatory. And so that's what gives all those different oils a tint of blue or as dark blue, right? And so calming to the body, calming to the physiology, calming to agitation in the body, because sometimes what's happened is certain parts of your physiology have gotten super agitated that then impacts the respiratory tract. So very, very calming to all of this, reduces inflammations in the body, and it also calms down a lot of emotions. So if a person's under a lot of stress, or if there's a lot of emotional turmoil or instability, in the old days, in medical aromatherapy, we would say, what was the term we would use? Excess emotion, right? Like, now we would say agitated, or that person got upset, or, that person's, fill in the blank. But if you look at it from a physiological point of view, there's excess emotion, right? There's more emotion than correlates to what is happening. So it's a way to calm those things down. It just calms all of that down. I mean, sometimes if I have a hard time winding down and going to sleep, I put the blue healer body tonic on and I lay down, and I don't flip and roll and change positions through the night. I just lay however it was when I put the last piece of blue healer on my body. However I laid back, that's usually the way I sleep for 4 or 5 hours. I mean, it just knocks me out. And so can be very helpful if there is an emotional component tied to the asthma. And keep in mind that it might not be that you have an issue, but the body is agitated and is keeps producing excessive amounts of emotion. And so that's what you're trying to calm down. Basically, the body is like going, take action in the environment, take action in the environment, take action in the environment. And there might not be anything going on, or something's resolved, but your body is so agitated that it keeps producing the emotion. Now, if there's trauma, one of the best things to use is helichrysum. Helichrysum, very, very soothing to trauma, helps to release the trauma, helps you to move past the trauma. So sometimes somebody might have a little bit of asthma, but it's because there is a past traumatic event that is maybe partially unprocessed or is just too overwhelming. And so if it's too overwhelming, start with the emotional support and then drop down to the trauma part. Spikenard can be helpful because it's calming and soothing. So like there was this one person, man, she was one of the toughest cases of asthma. And, I would treat her with all the clinical things and kind of nothing. And, I would even look at the emotional support, like the tarragon and the bergamot and the blue healer. And it made her feel a little bit better, but nothing. And, I would ask her questions, you do that little probing thing, like, tell me what's going on in your life, what's going on in the family. And she made this interesting comment. She goes, yeah, everybody in my family has asthma. And, at first you could go, oh, it's a genetic thing. And then you go, well, maybe there's something in the environment. There's some aspect of maybe a mold in the house or something. And as I kept asking her questions, the family had, not so much her, but the family had you could say lots of traumas and lots of deaths in the family. And it wasn't necessarily always her immediate family. It was like, maybe when she was really young, or even the generation before her, or her surrounding family. And so she was kind of in this family unit that had had a lot of trauma. But if you ask her, have you had any trauma in your life? She'd go, no. And I was like, tell me the worst thing that would happen. And she would come up with something like mild. Like I was like, really, that's the worst? I was like, I have 15 stories that are worse than that, like at least 15. And I was like, maybe she's not like tapping into it. And I mean, we really went through the history and there was just kind of nothing. But the family unit and the surrounding family, they'd had a rough time. And so when I treated her, like, I thought, well, maybe it's emotions. Didn't really touch it. When we started treating trauma, it started to shift the asthma. So, again, it's not just asthma, it can be your breathing. When you're dealing with trauma, when you're dealing with difficulty, when you're dealing with stress, your respiratory tract is going to fluctuate. And when things get too overwhelming, part of what you do is you make your, you're not doing this consciously, but your breath becomes more shallow so that you don't get overwhelmed. And it's a temporary fix. It's not a long-term strategy. Long-term, it causes health issues. But in the moment, it just keeps you from getting mentally overwhelmed, right? So you want to go through and unwind that. So helichrysum will help unwind the trauma, helps release the trauma, and it helps you to move past the traumatic event or series of events. It really helps you like kind of push through that particular component. So stress, again, Lang slowing things down. I mean, you're seeing there's a lot of similarities to the things that we're talking about. Lang slows down the breath, the anise, the rosemary verbena, tarragon can help reduce the stress, and they're going to help reduce the stress in the gut. because the gut is going to be impacted as well. We have the whole class where we did the digestive stuff, which we'll revisit again with more information. But for right now, you're kind of getting two things for one. You're reducing the stress in the body, but the two places that stress really impact you the most is respiratory tract and digestive tract. And here, by treating the stress with these oils, ANS support contain all three of those, and you could use that as well. But it can help the respiratory tract, it can help the digestive tract, and it will also just help reduce stress. You're basically trying to rehab a stress-plagued respiratory tract and a stress-plagued digestive tract. We all have stress. Nobody gets away from stress. It's not, am I stressed out or am I not stressed out? It's how badly am I stressed out? Am I this much or am I this much? It's not an either or, it's to what degree. Like it's always to what degree. Okay, so there's pursed lip breathing, but I'm going to come back to that. So let's drop down to cordyceps. This is other support. These are non-essential oil ways to augment treatment, especially if you're dealing with asthma, right? So quercetin is really interesting. Way back in the day, I would have different specialties, and I was working with people with car accidents, and one of the things that would happen is sometimes after a car accident, several months down the line, because of what happened to the neck and the shoulder, but also the trauma of the event, people sometimes would start to develop asthma. And so all of a sudden I noticed I was treating a lot of asthma patients in the middle of all of this. And several people were on inhalers. And the inhalers, I'm not saying anything bad about them. Inhalers are necessary sometimes. You can't mess with the breath. If it gets bad, it's potentially life-threatening. So, I never would have anybody go off a medication because I don't want to affect their quality of life. But I always tried to improve their physiology so that they could go off of it because they didn't need it anymore. You know what I mean? Like, I didn't just say, you need to stop this. I was like, let's get you to the point where you don't need that medication, right? One of the issues with inhalers is it robs the body of magnesium. So what happens is it actually starts to cause greater levels of spasms in some of the areas. It gives you some relief, but it can cause spasms in the respiratory tract, but in the body. But one of the byproducts was the jaw clenching, like clenching your jaw, and headaches. And we would use some magnesium to offset the symptoms, but the goal was to get people in a good enough place to where they could go off the inhalers because they just didn't need them anymore. One of the best things that worked was quercetin. Like if I gave them 3 capsules 3 times a day, usually within a week, they were doing substantially better. Usually, not every time, but I'd say 90% of the time, within 30 days, they would have a discussion with their physician and the doctor would do the little breathing test. And they were like, you don't need medicine anymore. Like you're off that. They would have them keep the medicine around, but they would just use it like in really difficult times. Usually within 60 days, they didn't even need it for like backup. So quercetin would get people off of the inhalers kind of quickly. Like it wasn't overnight, but within a month or two, usually it was the issue. Sometimes we did need to augment with cordyceps. Cordyceps is a mushroom, like a fungus that grows. In the old days, it grew on the body of a dead caterpillar. Now they grow it in like a lab. But it's very strengthening and fortifying to the body. It's very strengthening and fortifying to the lungs, the liver, and the lungs and the kidneys. And because of its impact on the lungs and the kidneys, it can improve heart function. And it also helps the body like process lactic acid. And, it's used by athletes a lot. Back in the 80s, there was, I think it was the early 80s, there was a Chinese team going to the Olympics, and, they're going through all the trials, and through all the trials and everything, when they were competing for their place in the Olympics, you could just say they were Olympic quality athletes, but they were mediocre in that group. They would beat us or beat me, but they were still in that genre. They were kind of mediocre all the way up into the Olympics. And then at the Olympics, they just rocked it. They just rocked everybody. And so they did so well, and it was so drastic that there was heavy accusations that they were using steroids. And they got tested by the Olympic Committee, and they were being examined and everything. No steroids. What they found out was they would take 3,000 milligrams of cordyceps every day, just I think they were doing capsules. And then at the end of every event, they would put some cordyceps in hot water and drink it like a tea. So their functions improved, and the tea at the end flushed out the lactic acid. So they were recovering at a much faster rate than everybody, and they just dominated the field. And so that's when cordyceps really kind of like everybody started going, what the hell is cordyceps? Like nobody had ever heard of it. And back then, like one ounce, if I remember right, this is back in like the early 80s, 1 ounce was like almost $100. So if you were using cordyceps, it was costly. But it was because they were still in the phase where they were going around in the mountains of Tibet, and they were looking for these caterpillars that were underground and then picking the little pieces of cordyceps. And so when they started to realize, they knew this in Chinese medicine, but outside of Chinese medicine, when they started to realize the potency of cordyceps, they started growing it in labs, and the price came down substantially. So now $20 or so, you can get a good amount of cordyceps, ounces of it. And one thing that I'll say about mushrooms, though, you want to get a good source of mushrooms. And I think we have some things that we've picked out with that. But the farther away that it gets from growing from the mother, like mushroom, like as it produces the babies, after about 5 generations, the potency dies down quite substantially. And so there are several things on the market that, yes, it's cordyceps, but it has nowhere near the potency because they're just cranking it out. They're mass producing it. So you want to kind of get a company that is like a more of an artisanal kind of thing, or at least they know, like there's a couple of companies, Host Defense, he's that mushroom guy. He's like the mushroom expert. After 5 generations from the mother mushroom, they destroy the mother mushroom and they start with a new mother mushroom so that they always keep potency high. And there's several people who are doing that. We found some other sources that I actually like a little better and a little bit more potent because they're smaller productions, like they're smaller production runs. And so if you are going to go down that route, we can give you the link.
Recommended
Yeah, we
ones.
can just tell you who to get it from and everything. And you can find it in a lot of different places, but get a good quality one. Magnesium just reduces the spasms on the respiratory tract, and if they were on an inhaler, it can be very helpful. Garlic is helpful in the reducing of allergies, and it's cleansing to the lungs, and it's helps to reduce like mucus and things that have been built up in the lungs. Flax oil and fish oil can be very helpful, both for the inflammation and deficiencies that might actually cause respiratory distress. Lobelia is an old school herb that relaxes the fascia, relaxes the diaphragm, relaxes the trachea. It's just a great way to calm everything down. We use it topically in some of our ointments and things to relax the body. The issue that I would say here is use capsules, not the tincture. The tincture sometimes hits the body in a little bit of a different way. And sometimes instead of it being like an herbal extract, it's a homeopathic. And don't have anything against homeopathy, but for this application, I find that homeopathy isn't strong enough. I mean, I tried it for a long time and I was like, a capsule worked way better than several dosages of the homeopath. Like I would start with the dosage they'd suggest. I kept trying to play with it to find good ground with that. I think it works for other things, but for this, do the herb. Paul Diarco is good for what you would call smoker's cough, or if there's been a lot of smoking in the past or exposure to secondhand smoke. You get this little bit of this like kind of cough or respiratory distress because of it. Paul Diarco is super good for that. Doesn't matter, tincture, tea, capsules, just take it daily for a while. It's something, if I remember right, comes out of the rainforest. And then it's always kind of good to reduce the intake of salt, just because it can irritate the lungs and the lining of the lungs. And anytime you have a lot of excess fluid in the body, it makes it a little bit harder to breathe. So the use of diuretics that I went through and listed here, birch, celery, juniper, lovage, parsley, sandalwood, mostly just topical. Like, if you apply them topically, it can be very helpful and make your body feel better. It helps your body to bounce back. You're starting to go into the realm of lymphatic work, and it makes it easier for you to breathe more appropriately. Keep in mind that part of how the lungs detoxify is through the skin. And so if we're really having a lot of fluid retention and lymphatic stagnation, that's impacting the skin, and your lungs aren't able to detoxify to the same degree. It's not just inhalation and exhalation, but the skin plays a role. And back in the, when was that? Like it was the early to mid 2000s. I did a research project where we did it on 102 patients, whatever you want to call them. And we were looking at allergies. And some people had food allergies, some people had respiratory allergies, a few had some skin allergies, but it was mostly either digestive or respiratory. And there was 4 things that really were a big trigger, and one of them was actually the skin. Even for digestive issues, it was still the skin. And even for respiratory issues, like if you keep the skin healthy, the organs can detoxify to a much greater degree. Let's go ahead and open up to questions. Unmute yourself or type in or whatever you want to do.
And we did have some pop up in the chat, I know a lot of you guys who have been typing in chat saw, I will get the names and the links for the ones that Greg recommends for you guys. And I'll work on that at lunch. Hopefully we'll have it to you by then. But if you do have any questions, still unmute yourself. Question, would krill oil work for the fish oil?
Yeah. Good call.
What dosage milligrams would the lobelia capsules be? And is there a recommended brand again?
Yeah, we'll get you the brand. They usually use a double-aught capsule, and I can't remember what the milligram works out to. I think it's probably like 400 milligrams or something. Just take a capsule a day is all you need to do. I mean, in extreme cases, I do 2 capsules, and but that's good. If you take too much, it'll make you vomit. So you'll if you overdid it. But two, 1 in the morning, 1 at night, or 2 and 2 if a person's a little bit bigger, you can do, but I wouldn't do much more than that.
And go ahead, Ralph.
Hey, you're off.
Okay, fluid retention. How do you tell if you have fluid retention?
Puffiness, most times you'll see it mostly in the legs.
Okay.
Especially the lower legs, but the legs will puff up. Sometimes you'll get a little puffiness, like say, you have a ring that you put on your finger and it's a little tighter than it should be.
Mm-hmm.
That's fluid retention too. The face can look a little puffy. Another way is you're not urinating as often, or the fluid volume coming out is not as much. Like when you go to the bathroom, like normally I would pee for, I don't know, 30 seconds, and now I'm only peeing for 20.
Okay.
There's starting to be a little fluid retention.
All right. Good.
Yeah. And so, I mean, I like to treat fluid retention quite a bit because it helps in lymphatic function, but it also helps keep the kidneys healthy.
Okay.
As we age, kidney issues will also dictate your overall vitality. And
Okay.
like animals, like for example, if you have a dog and you take it to the vet, and as it gets older,
Yeah.
they start asking you a lot of questions about how much the dog pees, does it pee a lot, how much water is it drinking, because really kidney health is reflective of the overall vitality and the longevity of the dog. And so other issues start to pop up with it, but it's like one of the things that you look at. And so for people, as we age, one of the things that we look at is, okay, we want to make sure cholesterol is good and liver function and digestive function. But if you just go to like base, like these are things that we want to make sure are going well. Endocrine function is one of them. Another one is kidney function. We want to make sure kidney function stays good and healthy as you get older, because, it's something we're going to talk about tomorrow is, and I put this in the newsletter, is the circadian rhythms start to go awry as we get a little older.
Yeah.
So sleep goes off, blood pressure can get a little wacky, blood sugar can get a little wacky. But one of the things with the circadian rhythms that I have found is it is a big contributing factor to frequency of urination and urgency for urination. And if you go through and you treat that, you'll notice that frequency goes down, volume goes up. The fluid volume that you're releasing goes up, and urgency diminishes somewhat. Sleep quality improves, like all these things get a little bit better. And so, we want to be able to look at the symptoms, but tomorrow we're even looking at like this is even like another layer of the onion where you're contributing to the overall health and vitality to the urinary tract and the kidneys and all that. And it again goes to longevity. You're trying to increase the potential for long life.
Makes good sense.
Yeah,
So if I have celery or if I have parsley, a couple of drops internal.
Yeah, the one here that I would not take internal is birch. Everything else internal is fine. Celery, parsley, juniper. Celery is very good for like cleaning up the blood, like lactic acid and things.
Yeah.
Parsley and lovage really super good for increasing the flow of urination and just really opening up the release of excess fluid. And sandalwood actually very good for blockages in the pelvis and the urinary tract. Also good for blockages in the lymphatic system, but more importantly in the venous part of the circulatory system. Like if there's like blockages, deposits and things, sandalwood cleans that up. And it's a very potent It's a very potent diuretic when taken internally. The issue with sandalwood is that true sandalwood is harder and harder to find these days. There is a different kind of sandalwood that comes out of Australia that it works, but it's not as well as like the old school true sandalwood. But a lot of the sandalwoods on the market are fake. You know, they're
Well, I only know of one reliable supplier, so.
but the Indian government spent $25 million, you know, this is many, many years ago, developing the synthetic formula for sandalwood because, you know, they export so much.
Mhm.
And I don't know about now, but back in the day, it was illegal to export sandalwood oil out of
Jeez.
India. But you'd see all these sandalwood oils that were on the market. They were either imported from somewhere else and then resold, or they were fake. And you know, the fake doesn't have, for one, it would be toxic to take internally, but it doesn't have quite the same diuretic effect. You know, they're just making up for the scent. So, you know, I haven't really looked around at other companies and everything, but you know, there's some sources for good sandalwood, but I'm always a little hesitant because it's one of the more adulterated oils on the market.
So if I think, well, I know I've got some fluid retention. So if I start with celery
Yeah,
for a bit
celery or parsley,
and then do
super
parsley and sort of rotate the two of them because it sounds like they have slightly different effects.
yeah, they do. And lovage is another one. Like I would say, lovage will help you release. Topically, it cleans up tissue, still acts as a diuretic. But the thing that's really nice about lovage is it really, more than all the other ones, it really improves kidney function better than the other things that are diuretics. And
Okay.
so they're all diuretic, but lovage is kind of the rock star in the diuretic world for improving kidney function. And I'll give you an example, like, you know, my body's mid-50s, you know.
Okay.
And I went to the doctor, you know, I don't know, about a year ago or whatever. And, you know, I just had a bunch of blood work done. I just wanted to evaluate like what's liver function, what's kidney function, what are all these things? And I had been doing a regimen for about 2 months. I started with a little bit of sandalwood for about a week. And then like for about 2 months, I was using lovage all the time, cleaning up tissues in the body, you know, releasing fluid retention and all that. And he came back and he's looking at my chart and he kept going, wow, your kidneys are really good. Your kidneys are really good. He goes, no, you don't understand. Your kidneys are really good. And I was like, well, I would hope so. And he goes, no, they shouldn't be this good. Like, this is not normal. Like his brain couldn't process, like, how did you get your kidneys to be this good? Is it like, and you could tell he really wanted to go down the rabbit hole with that. But, you know, he's limited in his amount of time. He probably told me my kidneys were good like 15 times in that thing. He kept looking and he goes, man, your kidneys are really good. Like, they're really good. And I just was thinking, that's the lovage. Like, you know, that's I did that little regiment with the lovage, and my numbers were just rock solid.
Okay. Lang, internal or neat?
You can
Or
actually get away
inhale.
with neat. Like here, there's not a big
Okay.
reason to take internal. Usually for Lang, taking things internally is more cardiovascular related issues.
Okay.
But even then, topically is hand in hand with that. So, but for this, topically is all you need.
Okay. And inhale?
Inhale's good, topically is better.
Okay.
Yeah, like a neat application of it, much better.
Okay. And that's it. Thank you.
You're so welcome.
And go ahead, David.
Hey, David.
Hi, Greg. Hi, Samantha. I just want to tell you, I've got questions and comments, but what I really want to tell you is your impact on me is really changing my life.
Oh,
So
good. I hope in a good way.
in a very good way, and I'll share that later because
Okay.
it's related to what you're talking about right now, but I just had to tell you because I'm so excited. So I just want to let you know that I'm proceeding with some of the things you've said, and they're really life-changing. So thank you.
Good. You could go ahead and share like what things are helping you, and it doesn't.
You know, I heard you say that a drop or two of frankincense with will, and I've been trying to remove myself from refined chocolate, probably a year. Successful, and I take 1 or 2 drops of frankincense in the morning, 1 or 2 drops in the afternoon, and I can free myself of chocolate completely. I'm taking cacao once in a while, but I'm not, my will is much stronger. In fact,
yeah, it does strengthen the will. Yeah, it does.
it's amazing. It's just, and then
and so does a Ling Ling, by the way. You wouldn't think of the Ling Ling doing it, but frankincense and Ling Ling are 2 things that are very fortifying to the will centers.
It's, you know, Jody said I'm a different person.
Well, that's good. That's kind of embarrassing because I was just getting ready to let you guys know I have a frankincense infused chocolate that I was going to bring to the market.
You know, and then the things you've told me for sleep are really helping.
Oh, good.
The spikenard on my feet.
Yeah.
And the rollerball of Palo Santo fruit.
Oh, good.
Really, just really helping.
Good.
Yeah, and that's just
glad you're doing better.
Yeah. I dropped out because I had a lot going on for a while, and I'm going to be continuing. And I've got some questions that are, I'll send you by email too.
Okay.
Thank you so much.
You're so welcome. Good to hear from you.
Just wanted to share. I mean, it's really, really amazing.
Oh, good.
Thank you so much.
You're so welcome.
And go ahead, Dorothy.
Hey, Dorothy.
Let's get you unmuted.
Hi. This fluid retention, we need to stay hydrated. How does that work?
Well, sometimes what happens, it's not that it's just taking fluid away from you, but what happens is when you take in fluid, either from your foods or your water, your body doesn't always utilize that fluid. And so what happens is it will throw it into the body tissues. And, at some point, the lymphatic system has to kind of scoop it up and then get rid of it through the kidneys. And so a lot of times when you're using a diuretic, it's not taking away the fluid that you're taking in. It's helping you to get rid of the fluid that's dropped into the body's tissues that then causes like stagnation and of lymph and blood moving in the area and the tissues to get a bit more toxic. So you're basically flushing out things that didn't get picked up by the lymphatic system, because the lymphatic system is also part of the cardiovascular system. You circulate this blood through your body, there's always going to be a little bit of fluid left over. And the lymphatic system comes around and picks up some of that and then processes it and gets rid of it. But when even that doesn't work is then you start to get fluid retention. So you're starting to get like some puffiness on the arms and the legs and things like this. And so as kidney function goes down, the tendency is fluid retention can go up. Also cardiovascular, like heart function, can cause fluid retention. And then also issues in the spleen. And in Chinese medicine, just because you take in water doesn't mean your body is always utilizing it. Sometimes what happens is the water comes in, but then just gets dropped into the body tissue. So there's like this component, like in Chinese medicine, we don't really have a term in the West for it, but it basically transmutes the water to help it to get used. And so sometimes this mechanism is diminished. And even though you take in a bunch of water, you either just pee it right back out or it gets dumped into the tissue. So when you're treating like really more serious, like kind of fluid retention or kidney issues, you kind of pay attention to the color of the urine, because it tells you, are you just passing water, or are you not having enough water transmuted and the urine's really dark and stinky, and you're looking at it. You always want it to be kind of a straw color, And it doesn't always have to be that way. Like, you might have a little bit of fluctuation, but if your urine looks like water or just like, a weak lemonade or something, then you're passing the water and your body's not harnessing the water. And if that's the issue, that oil or herb, Shazandra, is one of the things it's used for, is to transmute the water so that your body can harness it. So it's not necessarily that it's just flushing the water out of you, it's flushing the excess water out of you.
Did you say
Shazandra.
Yeah,
Yeah.
I'll get it in here so you
Yeah,
guys
yeah.
can know. It has a little complex spelling. So I'll get
Okay.
it for you.
okay? A coffee, is that a diuretic?
Coffee is a diuretic, yes.
So, well, I'm always thought so, but some people are now saying, well, they're kind of saying it can add to your hydration, but that's the opposite in my mind.
For hydration, I wouldn't say coffee is a good choice. Like it's a little pick me up, but topically, coffee is very different than taken internally. Topically, it does stimulate detoxification and it has a bit of a diuretic effect, but it really super stimulates lymphatic movement. Internally, it's a nice beverage, but I wouldn't say that it's hydrating.
Okay. All right. Thank you.
Yeah, you're welcome.
Oh, I have a question. You just did your book signing thing online.
Mhm.
Can we get a hard copy of your book by ordering it through you?
Do it through Amazon. We're not going to be distributing the books here directly. Like yeah, if you go on Amazon, it would I think the print copies, do we know when the print copies are? I think they print copies, they start printing and shipping on Monday. Yeah. I don't have any copies right now. Everything that I have is just the digital stuff.
I received in the email a booklet of your book. Do you know what I'm talking about?
There's a digital copy of the book that's free for the next few days.
Oh,
Yeah, on Amazon.
well,
I'll share the link as well for you guys so you can get the
Yeah.
physical book.
It's not really tied to the things we're talking. We're doing human design, which is the oils and human design. It's a type of like psychotherapy that's based on esoteric principles and things like that. So it's very interesting, but it's a little different animal. I have my irons in a lot of different fires. I don't always talk about what I'm doing in other situations, because they don't always overlap. But that one very much overlaps. But it's still when we do things with it, I usually do it with my co-author, which is Robin Wynn.
okay.
Yeah.
And go ahead, Denise.
Hey, Denise.
I had just a couple of questions on a few oils I purchased from
Sure.
you guys. But I'm guessing your frankincense is of a pretty good high quality. That should be one on my list.
Yeah, I'm very snobby when it comes to frankincense. I actually, let me rephrase that. I'm very snobby when it comes to all my oils, but like for example, like I probably pay twice the price for ginger because I want almost like a perfume quality ginger that's more therapeutic. Like, you know what I mean? Like I'm picky. I'm super
Good.
picky. But frankincense, we have probably maybe 8 or 9 different types of frankincense. Some of them are on the site and some of them are not. We are playing with this one that it's the normal frankincense that we all know, but it comes from this family that have taken care of the plants, the trees, for 8 generations, and they distill it there on their own.
Oh, wow.
And it's kind of different than some, I mean, not so much in the quality of the properties, but the scent is kind of different than some of the other frankincenses. And there's different kinds of frankincense, slight variations, but just the straight up frankincense, we have a very good source for it. And then that other source that is like a little artisanal frankincense that is from 8 generations. And there's this other kind of frankincense that they call emerald frankincense, and it's distilled from the same tree, but they only distill, how like you see those little resin nuggets.
Yes.
That's what they're distilling. They take the resin and then they distill it. It's only the green pieces of resin that they distill. And so, I mean, it is literally, the oil is a color of an emerald. It is the bizarrest thing you've ever seen. And there's not very much of it made, I buy up a little bit, but like that's a super, super fancy frankincense, but we're not able to get enough of it right now to even be able to bring it forth. I think I did put it in one blend, but frankincense Oman is what a lot of people call sacred frankincense. The Vital or Vital, but they usually say Vital, is a little bit more for like meditations and healing things, like kind of psychologically. It kind of shifts the brain a little bit more than some of the other ones. There's the frankincense premium, which it's still the normal frankincense, but it's distilled in a different way to grab more of the high notes and the low notes of the frankincense. So the scent quality is a little bit different. Therapeutically, it might be a little bit stronger, but the scent is much more intoxicating, you could say. And so again, hitting the brain. And then, there's a few others that, they're slightly different variations, but I'm real super snobby about my frankincense. Super, super snobby. Frankincense, sage, like there's a few things where I'm super snobby. Like,
Good.
I don't know if that's going to meet the match. I have sent several frankincenses back where I'm like, doesn't meet my
Right.
my parameters. Like even, we made that frankincense incense.
Yeah.
I got a special frankincense that's just for the incense. Like it's not even something I use in anything else. It's specifically it's like a heavier resin. So the scent lasts longer and it's somewhat of a different quality of a smell. And I got that just to make frankincense incense. I have a whole bunch of different kinds of frankincense that I could have just used for that, but I was like, no, we got to step our game up a little bit. So that shows you how like snob I am about the frankincense. I bought a special frankincense just to make incense.
Well, for today, like, and with asthma and all that, like if I
Just
was
any of the frankincense will work. Just get the basic generic frankincense. Yeah.
okay, that
Yeah.
was okay.
Yeah,
But it's
nothing
good to know about
fancy.
these others.
Yeah, they're all nice, but for that, just do the bread and butter frankincense.
Okay, and then how about the coffee scrubs? You guys have us. Would that help with your skin? And
Yeah, super good for the skin. Energetically, it's very cleansing. It's like an orange prana, so it really makes things expel out of the system. Very stimulating to the detoxification process in the skin. It doesn't have pain relieving properties, but because it's so energetically cleansing, sometimes I even use it like a pain reliever. Like it's just like I'll put it on a spot and I'm like, oh God, that area feels so much better. And like the orange healer or the lovage body tonic kind of does the same thing, but the coffee does it as well.
and now remember you guys made that lovage tonic for me. Would that be good for the asthma around Stephen's chest, or not necessarily?
It would help like diuretic effect and cleaning up the tissue, but it might not necessarily address the asthma as quickly. And is this somebody who has really bad asthma or mild?
Yeah, he's had pretty bad. It's done lung
I
damage
would go back to the beginning where it starts
with
to
the
talk about the initial phase. I would
Sure.
probably start with like lavender or mandarin or Roman chamomile and just do that for a little while. Like I'd follow that initial phase of treatment. I'd follow that for a little bit.
Great. Thank you. And how about orange? Just the essential oil orange that I bought from you guys.
For this, it would be okay. Mandarin would work better. Use orange for other things. It's very calming. It's very soothing, antispasmodic. It can do things in the digestive tract, uplifting. But for this, Mandarin tends to work a little better.
Excellent. And how about one last one? Because I've
Mhm.
wondered,
Yeah, fire away.
and I fell in love with it in England. All right. I just kind of found this tuberose. Let's
Oh my
just get
God.
tuberose. I love tuberose.
You're one of my people. I love me some tuberose. Yeah. Wherever you fell in love with it, good call. Yeah. Tuberose is
it.
amazing. Very good for activating the upper centers. Very good for shifting the brain and the mind. Good for prayer work, meditation work. Sometimes I use it, you know how, I'm trying to think of the way to say this. Sometimes you just feel stuck in the everyday world, like just the monotony and the grind of it all.
Yeah.
Tuberose will take you right out of that. And to give you an idea, different deities have different plants associated with them. And you can kind of almost tell like the deeper esoteric practices using the plant based on the deity and the kind of like the nature of the deity. And like, for example, like Tara and Padma Sambhava, who's the being that brought Buddhism to Tibet, and some of the Egyptian deities will use the lotus, like the blue lotus, right? They'll use it for certain practices. But in Tibet, the version of Kuan Yin is feminine in the Japanese tradition, the Chinese tradition, all these different traditions. But in Tibet, Kuan Yin is masculine. And so the difference is Kuan Yin, when any being, when they're shown more feminine, it's more of the love aspect. When they're shown more male, it's the will aspect. They're there to clean things up and to ease the suffering of the people as quickly as possible. When things have been stabilized, then the more love aspect comes in, right? So in the Buddhist tradition, or in the Tibetan tradition, the being that is Kuan Yin is known as Avalokit Ishwara. And it means one who hears and sees, like Avalokit, that's what that means. And then Ishwara means in the inner worlds, right? So it's the spiritual elder, in all the different traditions known by different names, but it's the spiritual elder associated with facilitating your thoughts and prayers to be heard and answered. And Avalokiteshvara has a big lay of tuberose around their neck. So it's very good for like prayer work. It's very good for being able to be super conductive super quickly, or to help facilitate the hearing and answering of prayers.
I love it. Now, do you guys carry a good quality of that?
Oh yeah. Again, you think I'm snobby about frankincense? I'm 10 times as snobby about my tuberose.
Okay.
There's different tuberoses from different areas, and even some distillers will do like a hotter or a cooler distillation using the same plant, and it will change the like the fragrance a bit, some will smell a little sweeter, a little heavier. And so usually I'll get a few different kinds depending on the availability. A lot of times the tuberose comes out of India, but there is a French tuberose that comes out. The quality is the same, the scent is usually the same, but it's about 5 times the price, 4 or 5 times the price. So a lot of times what they end up doing is they end up buying Indian tuberose, taking it to France, and then selling it as French tuberose. So a lot of the tuberose on the market is Indian. I have access to all of them because I mean, like, I love me some tuberose. And yeah, whatever you
So
want.
do you have a couple of varieties, or which one? Because the one I
The one
love-
that I put on is the Indian, and it's kind of in between, like kind of sweet with a little bit of a heavier note because it'll last longer. The
Okay.
one that's really a super high note, the scent dissipates really super quickly. Like if you put it on, after a little bit, you won't smell it anymore. And I like the idea of the one that I have because the scent lasts for a very long time because it's got a little bit of a heavy note. I think I have some French, and if I don't, I can get it. It'll take me a couple weeks because
I want the
comes
one that
from the-
lasts a long time. So
Yeah,
that'd be
that's
Indian
the one
one.
that I have. Yeah.
Okay.
Yeah.
And how I found it is I was in England and years ago, and it was in it was an actual little flower, the flower smells.
Mhm.
And it was the first time I'd come in contact with it. And I drove around with that in my little car. I only had 1 or 2
Oh, yeah.
steps, no more.
Yeah.
And wherever I stayed, bed and breakfast, and I have always, it's gone so deep into my heart, that scent,
Yeah.
So yeah, I'll definitely be treating myself with that.
Yeah.
Thank you so much.
You're so welcome.
That's great news to me today. Thank you.
And go ahead, Zakia, and then we do still have some questions.
Yeah.
in chat.
Hey, Zakia, how are you?
How's everybody?
How's the Bronx today?
Everything is good. It's been raining all night.
Oh, well.
So I have a client. You guys can hear me?
Yes.
I have a client who suddenly started getting darker skin on her face, sort of looking like emphysema, or not emphysema, psoriasis kind of look. There was no texture to it, but when I did her consultation, I could not find anything physiological. Her mom died last year. Her mom lived in the same house as her. She still lives in that house. So my conclusion is that it's an emotional stagnation with grief. And when you mentioned the skin being the detox for the lungs, I had shared that with her. And speaking to her recently, it's gotten worse. Is there anything that you would, any either essential oil or protocol that might help resolve
So
that?
it's not raised. It's just like the pigmentation is changing color a little bit.
Yes.
And she doesn't have any other pigmentation issues on the body other than
No. It's mostly on the face, but a little bit on the chest, upper chest.
and it's getting darker, not lighter.
Right, it's getting dark, and she previously had like beautiful complexion, but now she's like being psychologically scarred because she's ugly and this looks bad. And when I met her, she didn't look that bad. She didn't look bad at all. But of course, her own opinion of herself is what counts. And it's getting darker.
Is it around her nose and around her cheeks?
Around the cheeks, basically.
Like up high?
Yes,
Like up here?
yes.
That might be lupus.
Oh.
Yeah.
Would there be
I
any
would-
signs I can ask her about that would make it lupus, or any other questions I can ask?
I would have her get checked out by the doc.
Okay,
Just like if it's an autoimmune thing, I mean, there's a lot of lupus where it's just in the phase where it causes some skin issues. And if it's worse, then it starts to attack the internal organs. And so you can treat it as an autoimmune issue. And if I remember right, lupus, with that, you give them a couple of drops of clove a day, like 2 or 3, like probably 2 drops a day is good. That should help regulate some of the autoimmune issues, but it should help clear up some of the skin and reduce some of the symptoms of lupus. If you want to just do that for a little bit, but at some point she should go and get tested for any sort of markers for autoimmune issues.
Okay,
Like,
okay.
lupus is an inflammatory condition. So inflammation reduction is good. And you got to be a little bit careful with anything that is very stimulating to the immune system. So you want to use things like Moroccan thyme and Melissa and things that are fortifying to the immune system, but not overstimulating to the immune system. Because even cinnamon, very, very strengthening and very stimulating to the immune system. Somebody with an autoimmune disorder can use it, but you just can't take a big dosage at once. So like if we put 2 drops in water and we drank it to offset like a cold or flu, somebody with an autoimmune issue could do it, but instead of drinking that glass all at once, they would take a couple sips and then a couple hours drink, maybe another third of it, and then later in the day, finish it off. So you would just extend the dosage over a period of time so it's not overstimulating all at once. So
Okay.
there's just like little adjustments that you make for people with autoimmune issues. A lot of times things that I present for immunity, I factor in that somebody might have autoimmune issues. Like we're going to swing for the fences, but we're also going to take into account that there's autoimmune issues that are undiagnosed. So we don't want to throw anybody into a crisis. So, a lot of the things that we talk about should be relatively safe, but when in doubt, go to Moroccan thyme, because you basically for an autoimmune issue, you're also wanting to regulate the thymus, because the thymus will dictate the immune system going after the physical body. Like when it's out of whack and agitated, it goes after the body. When it's calmed down, it just goes after things from the environment, bacteria, viruses, things like that. And so it's sounding like a little lupus, it could be wrong, but given the location and what you're talking about, is she really hard on herself?
I think when I did a consultation with her, she seemed normal and calm, but as you know, the more you talk to a client, the more they reveal. And I think she's holding on to a lot more emotion than she's expressing.
When I've seen things with autoimmune issues, like lupus in particular, being hard on themselves, blaming themselves for something, or near-death experience before the age of 8 is usually the big things that come out.
Before the age of?
8.
Uh-huh.
Yeah. So then it means you have traumas to kind of address.
Right. So not wanting to alarm her, so I'm going to suggest she go to the doctor and get tested for autoimmune issues?
Just to cross it off the list. I'm not saying exactly that's what it is. I mean, we don't see
Right.
and even when I see it, but a lot of times you can kind of tell it almost looks like a little bit like a butterfly, or like a part of a butterfly, like on the nose and around the face and cheeks and stuff. It's not always all the same, but it's got like a little bit of a pattern that looks a little bit butterfly-ish.
But it's more fully on the cheeks than it is upper around.
Yeah.
Okay.
Yeah.
Okay, thank you.
I mean, the other thing is rosacea, but given what
It
you're
looked like
saying,
rosacea at all.
yeah, I'm going lupus on.
Yeah. Thank you.
Yeah, you're so welcome.
And go ahead, Ralph, and then we'll keep going to the chat related questions.
Hey, Ralph.
Hey, okay, skin detox.
Mhm.
What do you got? What do you have for that?
You could use coffee, you could use lovage, you could use like all the same things. Parsley is a good detoxifier.
Okay.
Celery is a good detoxifier.
Okay.
Even juniper can be a good detoxifier. And one that you wouldn't think of, hyssop is a good detoxifier on the skin.
Okay.
Spikenard is good for balancing the skin, not necessarily detoxifying. So you could follow up with spikenard, but those would be the big hitters.
Okay. Thank you.
You're so welcome.
Funnily, this actually was the first next question, and it was a while ago. And when is the class on skin coming?
Maybe the next time around we can do that. Like, I don't know, like with all the COVID stuff, I just thought, lung function and anxiety and all that stuff, lung function would be good. And, we always talk about the endocrine system, but it's a little bit more complicated to write out. I thought that would be a good next phase, but we're going to hit all the systems. We're going to also do some things that are a bit more esoteric and emotional, but I want to crank through all the systems at least once. Some of them I'm going to come back around and even do again because I'm constantly refining the notes. And so it'll be sometime soon.
Partially good for flow and excess fluid.
Mhm.
What did you say celery was good for again?
Same thing. Yeah. A little bit better of a detox of the blood, especially when it comes to like things like lactic acid or uric acid that's a bit excessive in the blood or in the joints, things like that. Juniper works that way too, but I used to use celery for endurance athletes just to help flush lactic acid out of their system.
Sandalwood use internal, how much?
Like 1 to 2 drops. I mean, if you take 3 drops, it might be hard to get a good night's sleep because you'll be getting up every hour or two to go pee. I've done that a couple of times where I took a sandalwood bath thinking, oh, it's cleansing, it's all this. And then as I get out, oh yeah, it's also a diuretic. And then I spent the night like peeing all night. Every hour or two I'd get up and what's the saying? Pee like a racehorse. Usually you use them during the day, but if you do excessively, it will just make you go to the bathroom more.
How much lovage to take internally for the kidneys?
Yeah, like 1 to 3 drops. Yeah, and same thing. If you take it too late in the day or too big of a dosage, you'll just be peeing it all night. Yeah. And the thing too is even like firming up tissues in the body, like if you use diuretics, it usually firms up the tissue. Like it can make you lose a little weight. It can make the tissues firm up. It makes your body feel better. It makes your body feel less achy. The use of diuretics is quite nice. It can regulate blood pressure. One of the first things that you look at for blood pressure is fluid retention, because there's different things that can throw the blood pressure off, but fluid volume, and meaning excess fluid, is one of the first things you look at. Like, is there a lot of fluid volume? And so, yeah, certain types of blood pressure call for different kinds of treatment. So that way, it's not just a blanket thing to treat blood pressure. So I usually start off with diuretics, actually.
Lovage, what is it? And how is it used for the kidneys?
It's used for the kidneys either topically or taken internally. Even inhalation will do it, but it's a plant. It's not a blend. It's a plant, and not super big over here. Europe, it's funny. We had some friends. I think it was Leanne's husband, where he's from Ireland, but I think he lives a lot in like Scotland or England or something. I can't remember. And we were talking about lovage. I don't know, casual conversations at dinner time always end up talking about plants, but he made the comment, he goes, yeah, that's in a lot of our foods. Like we eat it in salads, and they eat a lot of lovage in that culture. And so in the US, we don't really do that. I don't know that I've ever seen lovage in food, but it's just like in some of the cultures over in like China and I want to say China, they eat like slices of lotus, they chop up the lotus and they eat it. And so, different cultures will utilize different foods, and lovage, not big over here, big over there. And again, it's for kidney health and, flushing things out of the system and keeping the tissues healthy. And so, you would make it part of your salad or something.
Which Frank is the 8th generation one?
I don't know that we've put it on the market or on the website. I think we're gonna I was like, we have so many frankincenses, what are we gonna call it? I think we're gonna call it frankincense like ultra or something. So we could put it on by the end of the day, but it'll be about the same price as the normal frankincense. It's just different region, and it's just I love the story of this. 8 generations have taken care of these plants and done the distillation. And so I don't know, there's just something kind of nice and magical about that. I don't know, it's just interesting.
And someone just was sharing, it took me 3 days to notice an increase in urination the first time I took sandalwood. And I think I was using 1 to 2 drops.
Yeah, sometimes it can take a while, especially if there are blockages. Like sometimes the sandalwood is breaking up blockages. I'd say the first couple times I used it, I don't know that I noticed anything at all. And then I went and used some other things. And then now when I take it, I start peeing. Sometimes within an hour or two, I start peeing. And so sometimes we have like physical blockages in some of the urinary tract and bladder and things like that. And the sandalwood will go through and clear that up. And so sandalwood is like a very old school way to treat a lot of urinary issues, things in the bladder. It doesn't get talked about too much like that these days, but when I was trained back in the day, sandalwood was the go-to thing. Used other things eventually, but sandalwood was the point of the spear when it came to treating bladder and urinary tract issues.
Lovage root or leaf?
So the root is about 15 or 20% stronger and is almost double the price, I think, if I remember right. And so most times I use the leaf just because you can use it and not have to hold back on it and, really clean things up. The root is getting harder and harder to get for some reason. I don't know why. But so whenever that happens, the price goes up. So it's been a little while. I have the root, but the next time I buy it, it's probably going to be more expensive even than when I bought it last time. And so unless it's just like a really super critical thing to do, I use the leaf. Like that thing when I went to the doctor, I was using the leaf. I mean, I almost always use the leaf. And so yeah, I would stick with that unless there's just some crisis. And even then, you can talk it out with us and we can tell you if you need to spend the money or not. Most times there's other things you can kind of do, but we have it if you want it.
Lovage supreme, question mark.
I could probably, that's actually not a bad idea. Apparently you're giving me homework for tonight. I kind of like that. Lovage supreme. Oh.
You mentioned birch. Does birch tar also work?
Yeah, either birch or birch tar. Yeah, either of the birches. Yeah.
Great questions,
So,
guys.
okay, let's do this. Okay, should we break for lunch or come back into a little more? What do you think?
Your call.
How about we'll go ahead and break for lunch. It's 12:15. So we'll come back at 1:45. We'll take an hour and a half break and we'll come back and we'll start talking about other respiratory issues. I think we're pretty good with asthma, so we'll start bouncing around and looking at other things. Yeah, bronchitis, and we're not going to go blow by blow through this. We might jump around and just jump to the important things, or if you guys have questions. Like I want to talk about bronchitis, I want to talk about coughs, sinus issues. Yeah, and we'll go from there. So how about we'll come back at 1:50. We'll come back in an hour and a half. So yeah, everybody, let's go ahead and come on back. And was there any more questions? There's one more thing I want to do with asthma before I move on. Is there any more questions?
We got some name suggestions for frankincense. We have Heirloom Frank
Ooh, I kind of like that.
and then Frank 8.
That one's pretty funny.
I think they actually said frankincense 8. I
Yeah,
changed
yeah.
it to Frank 8.
Yeah.
Just check. Okay. As long as I use a different gel capsule for each oil, are gel caps as effective as taking the oils in water?
Yes. Yeah. Very great way to do it.
RSV question mark?
Yeah. So RSV, I definitely did put that in the notes. The way to treat RSV, I mean, a lot of times it resolves itself, but still we want to accelerate the process and keep the body strong. With that, you have a couple of choices. They can be diffused or taken internally. I guess the sustained inhalation would be just as good as diffusing, but cinnamon or savory are the ways to treat that. Yeah, can't remember what virus that is, but it's a respiratory virus. So
Why do the oils need to be in a different capsule?
whenever you mix oils, they become different, so they'll get directed in different ways. And so to keep everything or what you're trying to treat, you want to use them individually. If you just mix everything together, they'll do something completely different. They become a new substance. And so that's why blends, somebody doesn't know what they're doing when they're blending. A blend doesn't necessarily become stronger. Sometimes it becomes less effective, directed at something, unless somebody really knows what they're doing blend wise. A lot of times people think if they blend 3 or 4 things together that they'll maintain their properties and treat, several different things or aspects, but it becomes a new substance and it usually gets directed to a different part of the body. Yeah. So, okay. And so one of the things that we didn't do, we've done this a few times in the Q&A and I think in one of the study groups. I'm still kind of on asthma, but this is like also for shallow breathing. Anytime where you want to really open up the bronchioles. And it's called pursed lip breathing, and it's listed here, but it's not necessarily described. And pursed lip breathing is you're basically inhaling, holding your breath for a second, and then you're forcing the air out through pursed lips. So you're making a little tiny hole for the air to go out. And the idea is to try to force the air out through the little hole. And by doing that, you're opening up your bronchioles, right? So a lot of times with things like asthma and some other conditions, the bronchioles have gone into spasms. And you can kind of tell, like as you take a long, slow, deep breath, you notice it's nice and smooth and everything. And then when you go, okay, now I'm going to let it out very slowly. And, as long, if not longer than the inhalation, what happens is you'll take, maybe 15 seconds to go. And then you go, okay, now I'm going to let it out longer and slower. And then you go, right? Like you're not able to control the exhalation. That is the easiest way to check for a bronchial spasm, or instead of just going, you'll go, it'd be really unstable or will fluctuate quite a bit. And so this is good to do from time to time just to keep opening up the bronchioles. It improves lung function and oxygenation into the bloodstream, and it deepens the breath. And I find that it reduces anxiety. And one of the ways that you impact the fight-flight response in the nervous system is by deepening the breath and taking the spasms out of the bronchioles. So with that, let's actually do this process. Okay. So what you're going boy, I have a frog in my throat all day. So what you're going to do is you're going to inhale slowly and then hold your breath and then slowly push the air out through the pursed lip. So like you're pushing out a little tiny hole in the mouth. So it looks like this. And then inhale again. Purse your lips. And then one more time, inhale. Purse your lips. And then exhale. And then just be still for a moment. Okay. You're just being still. Okay, we're going to do it again. You're going to take a long, slow, deep breath in through the nose. Hold your breath and then exhale. And then inhale. Hold your breath and then force the air out of your pursed lips. And then one more time. Inhale. Hold your breath and then force the air out through the pursed lips. And then just be still for a second. Notice your body, your emotions, your mind. Just notice what happens. Okay, we're going to do one more round. So again, inhale. Hold your breath. Pursed lips. And then you're forcing the air out. And then again, inhale. You're forcing the air out again. And then one more time, inhalation. Hold your breath. And then exhale through the pursed lips. And just be still. Notice your body, your emotions, your mind. Notice your breath. How does your breath feel? So let's just open up. Does anybody have any questions about that particular technique? Let's just keep it about that technique for right now. After that, if you have other questions, you can do that too. But anybody have a comment or a question about that? You want to share an experience?
Is head rock? Oh, yeah, go ahead, Denise, then I'll ask.
Hey, Denise.
I think I have had a infection in my teeth and gums, so it was really hard to really do that to some degree.
Mhm.
But when I was more successful the third round, because it in a way I couldn't even breathe that deeply at first, but I was more successful the third round, and I did feel my head really clear.
Oh,
My
good.
mind got very thankfully.
Oh,
So,
good, good,
anyways,
good.
that's my feedback. Okay, thank
Oh,
you.
good.
Question, is head rocking important?
No. Yeah. I mean, if it happens, but not necessary. Yeah, it doesn't change anything. Okay. So let's drop down. There's a little bit of thing here about bad breath and, like causes and different things you can use to treat that. But let's drop down to bronchitis.
We did have someone share, I couldn't hold my breath, started coughing and took a while.
And so at first you had a hard time holding your breath. Were you able to hold your breath towards the end, or that was still kind of hard?
Yes.
Yeah, I would say probably do that daily for a little bit. That probably means you have pretty substantial bronchial spasms. The issue with bronchial spasms is not only does it affect your breath, but it actually will also increase and intensify pain, especially sharp stabbing pain, like any sort of pain that is considered neuropathic, which means just anything relating to the nerves. So sharp stabbing, tingling, radiating, all of that within when your body starts experiencing that, within like say maybe 2 weeks, you start to develop bronchial spasms. And when the bronchial spasms happen, it actually intensifies the pain. And so this is actually used even in some certain kinds of pain syndromes. And I find it also deepens meditation and things like that, but good to do this from time to time just as maintenance. But if you felt like you had an issue with this, I would do it daily. You don't need to do it excessively in one sitting, but over a period of time, keep doing it on a daily basis until your chest and your lungs really open up.
Actually, someone else had a share. I couldn't, oh, that one was that one. Opened up lungs and relaxed the body.
Oh, good. Yeah. Shallow breathing makes the body tense. So,
There we go. Thanks.
yeah, we're good. Okay. So before we start lecturing on a couple other things, any sort of respiratory related conditions that you guys want to ask about? I want to be sure that we answer your guys' questions and not me just like yakking all day.
Again, though, keep it respiratory related. But if there's something respiratory related specific, you want to make sure Greg talks about.
Yeah.
Is there a specific oil to use for that? Or
So a good question. So after you go through, I would not use an oil to do it, but like after you're done, you could start taking, you know what, let's just do it. Let's go back. Good call. Let's use something like hyssop, frankincense, Sitka, myrtle, pine, terebinth, melissa. Let's see if you guys have one of those, and if not, we'll come up with some other options, but let's start with that.
And again, I abbreviate Frank for frankincense, guys.
Check your oils and see what you have. Anybody need?
Someone's just asking what is the condition we're addressing?
We're going to do a little bit more of the pursed lip breathing, so we're going to be opening up the bronchioles even more.
And we're good.
Okay, so again, you're not using the oil at this point, but take again long, slow, deep breath. Hold your breath, purse your lips, and then force the air out. And then just be still for a moment. And then again, inhale. You're inhaling through the nose. Hold your breath. Exhale through the pursed lips. Yeah, sure. That'd be great. Yeah, breathe easy or bronchioles would also be good. Even pulmonary stress support would work. Yeah, good call. And then one more time. Inhale. And then force it out through the pursed lips. Okay, so you're gonna be inhaling the oil of your choice, the ones that we talked about. Just take long, slow, deep breaths in through the nose, out through the mouth. Inhale through the nose, and then slowly exhale through the mouth. Nice. It's like, I don't know, it's a large, but large works. Yeah. You're just taking long, slow, deep breaths. We might as well just turn this into a treatment.
Yeah.
Like, let's, we're kind of dabbling with it. We're going to go deep on this one. You're just inhaling right now. Long, slow, deep breath. And then just be still for a second. Just let the inhalation go. Just be still. This doesn't always have to be like a set protocol. You could kind of play with different aspects. So again, begin inhaling. And as you inhale, this time your awareness is on your lungs. You're really trying to open up the lungs quite substantially.
Would we still be inhaling oils?
Yeah. You're inhaling oil right now with your awareness on the lungs. Yes. Sorry. Yeah. Your awareness is on your lungs. You're just taking long, slow, deep breaths. You're not doing anything fancy. With your breath, you're just inhaling through the nose, exhaling through the mouth with the oils, and your awareness is on your lungs. Now, when you really want to unwind the bronchioles, you go to that little notch in between your two collarbones, the bottom part of your throat. Keep your awareness on the bottom part of your throat and take some long, slow, deep breaths. Your awareness on that area. You're still on that bronchial area, taking long, slow, deep breaths. And then just let it go for a moment. Just let go. Now let's go up a little bit higher to the throat, like the middle of the throat here. This also will still impact the bronchioles. So take some long, slow, deep breaths with your awareness on the throat chakra. Taking long, slow, deep breaths. This can be helpful in a lot of conditions other than just asthma. Even long COVID. I mean, it crosses my mind sometimes. Maybe this is helpful for long COVID, where there's respiratory distress even long after the fact of COVID passing. Take a few more long, slow, deep breaths. And then just be still. Let the inhalation go. Just be still. Now, without oils, we're going to do more of the pursed lip breathing. So again, you're going to take a long, slow, deep breath, hold your breath, and then force it out through the pursed lips. Inhale, purse your lips, exhale. Inhale, hold your breath, purse your lips, force the air out. Really force the air out. Just be still for a moment. Now use that same oil and again go down to that bottom of your throat, the throat minor. You're taking long, slow, deep breaths. Just in through the nose, out through the mouth. And this time, let's have you go to the back heart, the area between the shoulder blades. This area greatly impacts the lungs and the respiratory tract. So let's have you keep your awareness on the area between your shoulder blades and take long, slow, deep breaths. How's that feeling for you?
Yeah, I can't stop yawning.
So just to share experiences, Samantha said, like she can't stop yawning. So this opens up the lungs. Keep inhaling. I might keep talking. This opens up the lungs, but part of what it does is it calms down the adrenals. It helps to balance out the autonomic nervous system, which is fight, flight versus rest and repair. I mean, there's variations of this that we could spend quite a while on this little protocol. I'll actually even show you one of my little tricks. Mm. Now go to the front solar plexus, which is the area below your ribs on your upper abdomen. So this area and on the backside will impact the diaphragm and like the lower 20% of your lungs. We're focusing on the bronchioles, but we still want to open up the lungs as much as possible. So you're on the front solar plexus just below the ribs. Go to the back solar plexus, the mid back area, below your shoulder blades. Your awareness is still on that area. You're taking nice, long, slow, deep breaths. And then just be still. Let go of the inhalation. Just be still for a moment. Let your body acclimate to this shift. Okay. We're going to do the thing again where you do the pursed lip breathing. No oils. You're just going to inhale slowly. Hold your breath. Purse your lips. Force the air out. And then just be still for a moment. And then again, inhale slowly. Hold your breath and force the air out. Pursed lips. And one more time. Inhale. And then exhale. Okay, now pick your oil up again. And this time we're going to do a little different. You're going to take your left finger and close your left nostril and just inhale the oil on the right nostril. So inhale through your nose, exhale through the mouth, but just through the right nostril. And then let that go for a moment. And now with your right hand, close your right nostril and inhale just through your left nostril.
What do you do if one of your nostrils is plugged up?
Yeah, you still try to open it up this way. This is what this is for. More inhalations. Okay. So here's a trick, like somebody said, like one side of their nostrils are closed. We are going to talk about sinuses like after we come back from our next break, but this is a trick. Like it works most times, but if your left nostril is plugged, make a fist and like go sideways and put it under your right armpit, like so. And then you just kind of let it be there for a moment. And what happens is it will pop open that nostril. So whatever nostril, you go to the opposite armpit. So if it's your right nostril, you make the fist, you go under to the other side, the left shoulder. You can roll up a towel. You can take for a while I used to use you know how like you put your socks, you know, when you do your socks. I would like do it, but it needs to be big. So my socks are really big. So I would say most people's socks might not be enough. You can roll up a towel, use your fist, but whoever is having blockages on one side, if it's your left nostril, go to your right armpit. If it's your right nostril, go to your left armpit. So make a fist and just see which one's more blocked, and then try this. And all you have to do is just stick your fist in there sideways like this. You're doing it like that. And just let it rest for a moment and see what happens.
Someone already said, wow, left nostril opened.
Yeah, I mean, it works really quick. I mean, there's been a couple of times where it didn't work on me, but most times it works. And so the other thing, if the nostrils are really backed up, doing some jumping jacks for a couple minutes will usually open them up as well. It just makes everything unclog, unplug, whatever you would like. So after you've opened them up, just sit and be still and just notice your breath. Notice the inhalation, the exhalation. And so does anybody want to share experiences or ask questions about this process? What did you notice?
You can unmute yourself. You can raise your hand. You can keep typing in the chat. Somebody else wrote, my right nostril opened immediately.
Mhm.
I'm extremely relaxed.
Mhm.
Yeah, go ahead, Jane. And then.
Yeah, I have a question about the pursed lip breathing.
Hmm?
If you pursed lip breathe after you've inhaled an oil, will it help it to go deeper?
I don't know that it helps too much. It augments it too much. I find that doing it like afterwards, I tried it for a while, but you know what? I'm saying this for myself. It got to be like too many moving pieces. You know what I mean? Like, oh, I got to do this and I got to do that. And so I would just go through and do the pursed lip breathing and then be still, because you're manually, by doing the pursed lip breathing, you're manually opening up the bronchioles, and then the oil comes in and just continues the opening. So I would say focus on the pursed lip breathing and then do the oil afterwards. I mean, if you find it brings you some benefit, I mean, I don't think there's anything wrong with it. For me, it didn't really seem to augment it. So it just seemed like one extra piece that didn't really kind of matter when I was doing the pursed lip breathing. But if it does something for you, then I would say do it, but most times I do it like after the fact, like before and after. So,
Oh, okay.
yeah,
Thank you.
you're so welcome.
And go ahead, Denise.
Hey, Denise.
Hi, Craig. My left nostril's definitely really plugged, and I think it's the weaker of the two, if I were to guess. And I couldn't quite see in the video where your arm was. Could you do that
Yeah.
up a little higher?
So yeah. So you're taking, like, and you're making a fist, and you're not putting it in like this. You're putting it in kind of sideways. You want it to like open up the armpit, and so you're sticking it like right up in your armpit, and then you're letting your arm relax. And then you just kind of hold it there for a little bit. If this is a little awkward, take a towel and like roll it up, so that it's kind of like maybe about that big, and then stick it under the armpit. And then you're just kind of doing that. And within usually a minute or two, it will pop the sinus open.
And let that other arm kind of hang, if anything, let the
Yeah.
weight.
Yeah.
Okay,
Yeah.
I've got it now. Thank you so much.
Yeah.
I'll work on it because I think it'll help strengthen that side. Thank you.
It just, for whatever reason, it pops that open, and I mean, I'd say 9 times out of 10 it works. Yeah.
Excellent. Thank you.
What does coughing here mean?
What's
Like
that?
if they did the process.
Oh, it doesn't mean anything. You're manually opening up the bronchioles, and so things are shifting, and you're working on the spasms. Yeah, a little bit of coughing is almost normal. So I wouldn't read a whole lot into it. I mean, almost every time I do it, I cough at least once or twice. When I first started doing it, I kind of coughed like a maniac for a little while. And then as the bronchioles opened up, I noticed I started coughing less and less. But even when things are really good, I still end up coughing a little bit when it happens. And you're forcing something, you're manually opening. It's like kind of doing a massage on your bronchioles. And, like you get in and somebody does a little bit of deep tissue massage. It feels good afterwards, but in the moment doesn't always feel that great. But like afterwards you go, oh, that feels so much better. It's like that, but for the bronchioles. Like doesn't always feel the greatest right in the moment, but then afterwards you go, okay, no. Then you go, God, I'm breathing so much easier, like so much easier.
Share my central channel from solar plexus to crown feels more spacious.
Oh, good. Very good.
Why does that work? The armpit.
I'm not sure. I think it's a fascial thing. God, I can't remember how I was taught that like 30 years ago or something. It could be meridians, but my guess is it's probably a fascial release technique for opening up the head and on the upper parts of the fascia. But other than that, I don't know. I just know it works. And so I got to be honest, the first time somebody showed me, I was like, really? This is what we're going to do? And then I did it and I was like, this is kind of amazing. I am not sure why. And boy, I did this for a little while. Like before meditation or doing breathing exercises, I would do it on both sides, open things up. And, now I just do it when I have a problem, but it works. It's tried and true. Yeah.
Is there a trick for unclogging ears too?
No, not that I'm aware of. There is this little adjustment that chiropractors do sometimes. I've tried it on myself. It never really worked. So yeah. A lot of times that's allergies and inflammation. So going back to the quercetin and using hyssop, a lot of times that will unclog it at some point. You want to also make sure there's no water in the air. If there's water in the air, use some like peroxide or something to dry it up.
I broke my nose on the right side, and that's the side that's not as open. Is that why it's not as open?
It could start to have a little bit of a structural issue, or it might have caused a deviation in the septum, like in the passageway might be narrowed, and so you still can open it up. I have a little bit of that issue, not bad, but you just have to compensate a little bit. Some people are born that way, by the way. Deviated septum. Yeah.
Feel like my lungs can expand more fully.
Oh, good. Yeah, very good. So we just did a pro call, so let's give you a little bit of time to integrate that. So let's come back about 5 after, and then we'll jump into sinus issues. We'll still cover coughs and bronchitis and things like that, but we'll jump into sinuses. I think that's the second most common thing. So let's jump in and talk about it for a while. So see you at 5 after. Sorry for running late there. So let's drop down to if you all say page 1.
Okay, so we did do an updated booklet.
Okay.
I sent them the link. I'll get you the link as
But
well.
what page is the sinus thing on?
Sorry, it's right there. So the sinuses, guys, we'll find the page. I did send the link of the updated workbook that has the numbers on the bottom to you all as well. So if you need that link again, let me know.
So number 11, sinus issues. We'll drop down to wherever that is in your booklet.
Number 11, you said?
Yeah. And then it looks like my booklet bottoms out there.
Okay. Yeah, it's the last one. If you have the updated booklet, it's going to be page 17. Number 11, sinus issues. Thanks, Liddy, for posting that.
Okay, so we're looking at sinus issues and we're looking at different things. So this is a very common thing that people ask about. So instead of just saying sinus issues, I broke it down to different aspects. They do overlap a bit, but when you're really trying to address a specific issue, I tried to lay it out for you here the best that I could. So first we're looking at infection. And again, you see nasal congestion, sinus pressure, headache, postnasal drip, cough, fever, which is reflective of that there's an infection, and fatigue. Sometimes with sinus infections too, you'll get like pain in the upper teeth, especially like on the sides, like not in the front, but on the sides. You'll get that. You'll start smelling like weird odors and things. It's actually the infection in the nose. And so here are a couple of things to use. Any of the eucalyptuses will work, lavender. Lemon is best used internally for this. Can help kind of liquefy a little bit of the mucus to have it come out. Neoli especially good for this, and thyme. The thyme you could use to inhale, because the issue is that when you have a sinus infection, your mucous membranes in your sinuses don't have the greatest blood supply. So even like taking things internally, even like antibiotics, a lot of times people will have to do 2 or 3 rounds of antibiotics. And again, it's because the poor blood supply to the nose doesn't really allow for the medication to get up there as easily. And so I do like to use both things internal and inhalation in this particular case. Thyme, it works really well. Thyme works really, really super well for this. Any of the thymes will work. I kind of go through a thing where like thyme linalool, thyme thuyonol, geranol, or the benchmark thyme is a lot of times what I would use for the treatment of the sinuses. Inhalation, a few drops in water taken internally. A lot of times that will knock it out. Yeah. So the big thing, because a lot of the symptoms and some of these things look kind of similar, the big difference here would be the fever and mucus, or the impacted mucus. Now, sometimes people will look at the mucus coming out, and if it's clear, or if it's green, or if it's yellow, is it infected? Is it not infected? I asked a couple of different doctor friends that I have, and they said that there were some studies done, and the color of the mucus doesn't necessarily mean that there's an infection or not. I don't know. I've had other doctor friends tell me otherwise. And so I would just say, don't let the color of the mucus be an indicator of whether or not you say you have an infection or not. If you have some of the symptoms and you're starting to feel a little hot, a little feverish, then I would just assume and treat appropriately. And then with sinus inflammation, again, this can be a byproduct of viral infections, bacterial infections, allergies. Yeah, one of the best treatments for this is rosemary, verbena, or neoli. Those two are rock stars when it comes to inflammation in the sinuses. Both are inhaled, applied topically, and a few drops in water taken internally. Now, here's the thing. it's not going to be an instantaneous like, oh, I've got relief, and in the next 30 minutes I got relief. It'll help, but if you really have a lot of like chronic sinus inflammation, you're going to have to treat it for a little while, like for a few weeks, maybe even a month. You really want to knock it down quite substantially. And so a big thing that happens with sinus issues, but especially inflammation in the sinuses, is also look at stress levels. If stress is real high, the tendency is for there to be inflammation in the sinuses. Because if you look at it from an energetic point of view, is stress is like kind of a dirty red prana that gets stuck in the solar plexus and then eventually moves up and then gets stuck in your face and in the nose. And so I always found it very interesting when I was doing corporate work. Depending on who I was working with, like if I was working with the HR department for a particular company, tendency was migraines, low back pain, and high blood pressure. They're dealing with people being angry at them all the time, and the energy projected caused the migraines, the low back pain, high blood pressure, right? People who had very deadline-oriented jobs, like where they're stressed and they're meeting deadlines, or they're just pushing. The big complaint was sinus issues. And so it could be because of work, it could be that you're stressing about things going on at home or situations or things you see in the news or whatever, but do things to reduce stress for this particular issue. And again, consistent use of rosemary, verbena, or neoli, incredibly helpful for these conditions. Mucus, just lots of heavy, thick, sticky energy, or excuse me, mucus. Anula is one of the best things for mucus. It helps break down mucus. Eucalyptus is an expectorant, so it is helpful, but terebinth, like the anula, breaks it down. Like the anula, like is an expectorant. It is a thing that you use that is like anti-mucus, like it will reduce the production of mucus in the body. Terebinth actually will dry things out. And so if it's already thick and sticky, and one thing I almost put here and then I didn't, but sometimes you just got to make the nose run. Like you have heavy, thick, impacted sinuses. There's a heavy, sticky mucus in there. Use something like black pepper or thyme to loosen things up, make the nose run, so you flush that mucus out, and then it usually will regulate itself. If you do need to dry it up, then just as you've flushed everything out for a day or two, then use the terebinth to dry things up. Runny nose. One of the best things for a runny nose is angelica. I usually will take a few drops of it internally or put several drops on it of it on my wrist, and I inhale a little bit of terebinth, and boom, it really kind of knocks it out. So let's open it up to questions about sinus related issues. Go ahead, fire away. Unmute yourself or type in.
Type this in for you. It's Anula, INULA.
Mm-hmm. Yeah. In Europe with Anula, in certain European regions, it's a bit of an expensive oil. I mean, it's not the most expensive oil, but I mean, it's not cheap. It's a common practice for people to, like, going into the wintertime, they'll buy Anula And then I'm not telling you to do this. I'm just saying this is what they do in Europe. And then they'll put a couple drops every night on their pillow. And so as they're laying there sleeping, they're inhaling it, because a lot of times the mucus, because of you being in that position of laying down, will kind of clog up. And so that's how they get through the winter time, is putting a drop or two of the Nula on the pillow and then just inhaling it through the night. And so, yeah.
Yeah, go ahead, Rob.
Hey, Ralph.
On making the nose run, you said black pepper and what else?
Thyme. Like,
Thyme.
yeah, I like to use the softer thymes, but any of them will work.
Okay, thanks.
Yeah, you're so welcome.
Application for rosemary, verbena, and nioli for inflammation.
It's all of the above. You would inhale it, you would put it on the body topically, like you could rub it on the chest or a few drops on the wrist, and then I would still take a couple drops internally.
Is spike lavender good for sinus issues?
Spike lavender is a little bit more for cerebral spinal fluid circulation and like aches and pains. It's actually not a true lavender, even though it has lavender in the name. It would be okay. It wouldn't be one of my top choices. Yeah. So let's drop down to sore throats just below all this. Again, this is another area where essential oils really can thrive. And you can see there's like kind of a description and then symptoms and then causes. And let's drop down to treatment. Okay, actually that's, so sore throats, most times they're viruses or bacterias, but the thing is, sometimes a sore throat is an accumulation of lymph that gets all stuck up into the throat. So it makes you predisposed for the sore throat, and it can make the sore throat last longer or happen often. And I remember like this again many years ago, I had a person come and she had constant like chronic sore throats. And when she came, I think she had had a sore throat for, I don't know, it was like a long time. It was like 3 or 4 months. And she had been to the doctor. They had done a culture on the throat. There was no infection, but she's like, my throat is constantly sore. And so I started treating the throat directly. And then I was like, got a little bit of a hit. Let's try something different. And we opened up the lymph nodes of the armpits. And I mean, during the session, she said the sore throat went away. And then after that, she said maybe one sore throat a year. And, you know, like I kind of followed up with her as time went by. I was treating other things with her, but the sore throat issue was just really a bunch of stagnant lymph. And if you're non-responsive to some of the treatments, then always go back to the lymphatic system, especially for a sore throat. Now, one of the best treatments for a sore throat is bay laurel. Bay laurel is one of the best things for a lot of different kind of bacterias. Like it's good for staph, it's good for strep, it's good for a lot of things that would cause sore throat because of bacterial or viral issues, but it's one of the things that you also use for stagnant lymph. So kind of a go-to thing for sore throats is literally the use of bay laurel. Grief can be a little bit of a different thing. Grief, there's this thing called was it plum pitchi or plum chi? I think it's plum pitchi in Chinese medicine. And basically, like grief sometimes will get caught in the throat and cause like a sore kind of feeling that just even makes it a little bit hard to like swallow. It can cause some coughs and things. And it's just like there's excessive amounts of grief, and it might be even unconscious. It's not just a person passed away or something like that. There's just, maybe things haven't been going well, or a circle of friends, there's some issue amongst everybody, or the loss isn't always a person, right? And so, we do make a little blend that's real specific to that, but for that one, ginger lily can work, like just inhalations, or Melissa by itself can work. It can help break up that and help you process the grief. And so, yeah, and then acid reflux would be a little bit of a variation like that. The bay laurel may help with that, but sometimes you need to go through and kind of treat the acid reflux. So like ginger, or which tonic of yours that we use for that? Is that fire tonic or the ginger tonic?
That's the the ginger tonic.
Yeah, so we use ginger for acid reflux, and then Samantha makes an apple cider vinegar with raw apple cider vinegar, where she puts the herb of ginger, and we put a real super strong form of ginger in. It's a ginger CO2. It's on the side as well. It's not the primary form of ginger. It's a much more potent ginger. And a lot of times that will knock out the GERD, the acid reflux. And so the other one, going back to the sinuses, mouth breathing, people usually mouth breathe because the sinuses are blocked. So I would go back and say, treat the sinuses so that you're not mouth breathing all the time. And again, here are some tricks. Turmeric actually works quite well for sore throats as well. In the Indian culture, they'll usually, like the mom or the wife, will have a piece of turmeric in the kitchen. And when somebody has a sore throat, they cut off a little tiny piece and stick it inside the lip, between the gum and the lip. And you suck on the turmeric for a little while, and it makes the sore throat go away. So you can use turmeric essential oil as a gargle, take a few drops internally and rub it inside the lip. I've done that. It actually is quite effective. And so, yeah. Anyway, questions about that? Anything about a sore throat, or difficulties in treating a sore throat, or any sort of variations of that?
You had mentioned the lymph in the pits,
Mhm.
armpits.
Mhm.
Where are those exactly?
The armpits?
The lymph, like where they go?
Oh, I would just treat the armpit. Like just take some bay laurel and rub it like on the outside, and kind of, if your armpit can handle it, like in a little bit of lotion or massage oil, just rub on the inside of the armpit. You could also inhale. Let's do this. If you have bay laurel, ginger, or turmeric, let's have you pull that out. If not, lymphatic blend, chocolate root cleanser. Even if you don't have that, like hyssop, eucalyptus, rosemary, anything like that. Let's just do a little experiment. Swallow a couple times just to see, with your awareness on your throat, and just see how your throat feels. A time will work, any sort of time. Okay, now we're going to do just one armpit at a time, just so we can compare. So let's focus on the left armpit. We're not even going to put it on topically. You're just going to take long, slow, deep breaths. Your awareness is on the left armpit. Keep taking long, slow, deep breaths. Your awareness is on that same armpit. Okay, so at first, see how your left arm and your right arm feel. Yeah, noticeable.
I actually feel like all those areas.
Yeah,
but-
so Samantha said, like, she can tell the difference between the shoulders, but like she feels it all the way up, like from the side of her ear down and then across the top of her shoulders, right? And then the other side, you don't feel that, right? So like sometimes when we want to go through and just validate, like, this is what this is doing, you treat one side so you can compare, like, okay, this one's doing this, nothing's happening over here. So you can see the effect of the approach, but you can also see that where you put your attention on some of these things kind of matters sometimes. It's not just inhaling the oil or the plant. You want to direct it to a place that's going to produce a result, right? You want to produce a result. Well, I could go on about that, but that's enough. So, and then swallow, like notice, do you feel a little bit of a difference in your swallowing mechanism and in your throat? Is it a little less sore? Does it feel a little bit easier? Feel not as heavy?
Feels like there's movement.
Yeah. So Samantha's saying that feels like there's movement. Like sometimes it literally will feel not like mucus going down your throat like drainage, but it feels like something's draining out of your throat. It's a clearing of the lymph nodes.
Somebody else said my throat feels spicy, another easier to swallow.
Yeah. Easier to, like, when the lymph nodes are really impacted, it's becomes more difficult to swallow. That's why I was having you swallow. And so anytime where the swallowing thing is an issue, clean up here, but clean up the lymph nodes of the armpits. So let's go to the other side, to the right side.
And this is bringing up a couple questions for people. Wait till the end after we do this part.
Yeah, we'll do this part and then we'll do questions for sore throats. I think if you get really good at treating sore throats, I mean, they're common, everybody gets them. So if you get good at it, you can just knock them out the day they happen. I can't remember ever having a sore throat longer than a day after really getting down how to treat them with oils.
And we're on the right armpit now.
Yeah, the other armpit. So you're taking long, slow, deep breaths. And now do both armpits at the same time. You're taking nice, long, slow, deep breaths with both armpits. Samantha just gave me a funny look and she goes, okay, my feels like my sinuses are opening up as well. Yeah, like anytime you open up the lymph in all this area, throat gets better, sinuses get better, everything opens up. So you're still doing both armpits. I mean, we're doing it. Let's not just kind of play with it. Let's like really do a little bit of a treatment. It's very short. Like this treatment's very short. So give yourself a break. Just be still for a moment. Notice how your throat feels, your neck, the side of your neck, your shoulder, your swallowing, your sinuses, your breathing. Okay, so now you're going to continue to inhale, but this time now you're on your throat, right? To treat a sore throat energetically is throat and secondary throat, and then armpits. So you're going to inhale on the throat. Feeling good.
Oh my gosh, it's so good.
Samantha's giggling. She's like, oh my God, this is so good. You know, we've had a lot of weather fluctuations, like it's 65 and then it's 25. And then a few days later, it's 50 and then it gets up to 80 and then it's back down to 25. Wreaks havoc on the sinuses and mucus production, wreaks havoc on that. And then drop down to the throat minor, the bottom of the throat.
Oh.
Now go to your jaws where they hinge in front of the ear, still tied to the throat chakra. Both sides. Long, slow, deep breaths. And now go to the back throat, the middle of the back of your neck. I think you've yawned more in the last 10 minutes than you have in the last 10 weeks.
This is my yawning class.
Just by what I see with Samantha, I think we should have called it yawning yoga and just called it a class. But it goes to show, like keep inhaling, but it goes to show how much when you open up the breath, how much it impacts your nervous system. Because when you're yawning, you're shifting out of sympathetic activity and going into parasympathetic, like rest and repair. It's rebooting the nervous system, and energetically, you're kicking off dirty energy by doing that. And so yawns are good on a lot of levels. You're taking in more oxygen. It's just also a little contagious. You're gonna get me yawning here, and then I have to start looking
And then
away.
you'll get the whole class.
Right. Okay, so let it go for a moment. And you can see this was not a very long treatment, but there's a couple, we want to do a little touch-ups. Notice how you feel, notice your whole body, notice your throat, your swallowing, right? Even sometimes your neck, moving it around, but also check in with the sinuses. Yeah, so Samantha's even saying her ears opened up. So somebody was talking about plugged ears. I hadn't thought about it. This actually might be a treatment even for that. I hadn't thought about it like that, but maybe we need to make a note of that and I'll put it in the notes. Like we'll play with it, make sure it does it consistently, but
Yeah. What oils?
yeah. So let's just do a little bit more. And you know, most times we're treating both armpits. We do them both at the same time. I like the idea of going one at a time so that you really move the energy in that one spot. So let's start with the left armpit. And again, let's just long, slow, deep breaths with the same oil on your left armpit. You're still on that left armpit. And now move to your right armpit. Mhm. Yeah. Yeah, if you want to change the oils and rotate to one of the different ones, yeah, have at it. And then do both armpits together. Long, slow, deep breaths with your awareness on both armpits. Okay, now notice how you feel. Now, if you're having more severe, like you do this and you've taken a little bit internally, you've done a little gargle, you did this like breathing pattern, and you're still having a little bit of an issue. Like if you look right below sore throat, it jumps down into tonsillitis. And the tonsils are these two little things in the back of your throat that help to filter out, bacterias and just anything that would cause you not to feel good. And anything that's just a disruptive substance, something that's not going to make your body feel good. They go through and filter these out. And so bay laurel doesn't quite touch those. Like the turmeric doesn't quite touch those. The thing that actually touches that the best is actually clove oil. And again, you can inhale it. You could take a drop or two internally with plenty of water, because clove can be a little hot, with plenty of water, or you can put a drop and really go, like in this one, you'd want to kind of gargle, like tilt the head back and like really gargle at the back of the throat. And there's this herb. It's kind of hard to find. It's a very old school herb. Tonsillitis is usually more of a kid issue, although we can get it as an adult, but kids can be really prone to tonsillitis. And I can't tell you how many times I prevented a child from having their tonsils out by giving them this herb called red root. And I mean, it's just this red, like powdery substance that I would make into a tincture. And a lot of times with a day or two of treatment, it will kind of disinflame and clear out the tonsils. And so if you're really prone to tonsillitis, or you have a child prone to tonsillitis, or as an adult, you get sore throats and they're just not clearing up very quick, I would actually treat the tonsils. It doesn't mean that something has to come out. You just need to clear them out. And it's good to do for lymphatic function as well. It helps the throat to do better. As far as fighting off bacteria and viruses and cleaning up the lymph. And so I would take this into account. And so I've even had a few times, not very often, but somebody with even some chronic coughs. We used a little bit of clove oil for that. And most times it didn't make a big difference, but there was a couple cases that as soon as we started giving them clove, done. So it was actually the tonsils were getting so inflamed that it was actually causing a little bit of a coughing spasm. And so the red root you can make into a tea, a tincture, a capsule. Like I'm not even sure you can find it on Amazon. We have a source for it. I get it from time to time. I buy a couple pounds at a time, but we don't go through it all. I mean, it's not a very commonly used thing, but like a little funny side note is there was this, when I lived in Central California, I probably had prevented like 15 surgeries, where kids were going to get their tonsils out and we would treat it. And that I got a scathing email from a doctor one time that I needed to knock off my treatments, but it was because I had taken a bunch of business from him. And so I was like, yeah, it's a compliment. He didn't mean it as a compliment, but it was quite the compliment. But that's how well it works. Like, I'm not kidding. The combination of clove and the red root, I mean, it just opens up the tonsils. So if you have like a really chronic sore throat, I would say, you keep trying to treat it, but I would actually treat it as the tonsils are inflamed. And a lot of times that will open it up. So you're almost treating sore throat and tonsils at the same time. Can be a dramatic effect. I don't find that the inhalation of cloves, going through the patterns and everything, I don't find that it does things as well as, drinking it, gargling with it, doing it that way. Like you need to almost ingest it. But anyway, let's share experiences. We kind of learn from each other with the experiences, and then whatever questions you guys have. So go ahead and unmute yourself or type in and fire away.
I'm gonna scroll up here, guys. Get your questions from earlier. How would you treat strep throat?
Yeah, same protocol. You could augment, and like bay laurel is actually very good for the strep, and thymethuyinol is actually good. So like if you wanted to do extra, you could use the thymethuyinol internally, but you're definitely going to use bay laurel internally. I'd rub it topically in and around the neck, inhale it a bunch, but it's pretty good for knocking out strep. Yeah, very, very good for knocking out strep. Clove is an incredible antibacterial substance. Bay laurel is a rock star when it comes to bacteria. I mean, it's just, I don't know. It's the Terminator when it comes to bacteria as far as essential oils are concerned. It just goes after pretty much every kind of bacteria. It's just, it's an amazing oil. It should be part of your toolkit for just anything goes. Like it's invaluable. Like I can't come up with something like, oh, you could use this or something else. Like bay laurel, just get bay laurel. Like bay laurel is amazing.
And go ahead, Denise.
Hey, Denise.
Okay, thank you, Samantha. She took my hand down. Okay, I have, when I talked to you on Tuesday, I do have two teeth easily that are infected in the gums, right? So everything's way draining, and actually even my hands and wrist were hurting and my left breast. So I really sneezed a whole lot. It helped open things up, but the only little bit of sore throat, because it was very definite before, but I do have a little bit in that lower, that between the two notches. And so part of it is just the drainage going on with this infection, right? When I'm okay, just keep up doing what I'm doing.
Yeah, keep up doing that. And because there's some tooth infection, like gargle a little bit more, like for that, not even gargle, like do like that, just swishing around in your mouth with a little bit of clove in water. If you don't have clove for that, you could just do bay laurel. You could also do tea tree for that. Tea tree is also really good for a lot of these kinds of things. And so sometimes not a choice, but it does a lot of things well. And so
do you spit
like
it
things,
out?
what's it?
Do you spit it out after you
I would
switch
spit it out because you're swishing around and you are pulling some stuff out. At the end, you could drink some and take it internally, but like when you're swishing around, spit that out because you're kind of pulling some of the bacteria and the debris out, and so you want that out of your mouth.
Okay, very good. Thank you. I do have all three. Thank you so
Oh,
much.
tremendous. Good.
And go ahead, Anne.
Hey, Ann.
Surprised when I was breathing into the armpits,
Uh-huh.
my gums, and I could feel the roots of my teeth in the upper.
Yep.
Wow.
Yeah. It's kind of amazing, isn't it? Like, we don't really think of the armpits being like that big of a deal. And then you do something like that and you're like,
Wow.
because it opens up things so much for the circuit of lymph and things to move in the body. It just opened things up. It's really quite amazing.
It was almost scary.
Is there a preferred carrier oil for lymphatic blend?
You have just regular sesame oil or the sesame complex, which is sesame oils with different kinds of sesame oils, because there are different kinds of sesame oils. But it also has like some herbs and things in it to help. If I remember right, it's like, what is it? Is it the ashwagandha or the gotu? It's gotu kola. It's got gotu kola in it, so you can add the essential oil to it and then use it as an ointment. Whenever we make a lymphatic ointment, I use a combination of herbal oils and sesame, and then I add the essential oil to it. So it makes it like really, and in fact, I think I add just a little tiny bit of coenzyme Q10 to really make the lymph move. Yeah.
Sorry, I was just trying to see what we had on our website. We have Spasmophilia Gotu Kola therapeutic ointment, but we don't just have the Gotu Kola with the sesame on the website.
Yeah, we could. Yeah. We could. We have a bunch of herbal, like herbs and sesame oil or different kinds of oils and alcohols and things that I use to make products, but I don't think it all makes the website. But if there's something that you want, I mean, you always ask. The new one that we have is, I'm like almost giggly about it, is arnica oil in sesame, so they chop up arnica flowers and then soak it. And then we have St. John's wort the same way in calendula, but we also got, I got an arnica CO2. So I have an arnica essential oil now. And then we put the arnica essential oil and the St. John's wort and the calendula. So we have it in an herbal extract and an essential oil extract, and we mash it together. And some, like, I think I called it arnica complex for around here. It's going to be in the kit for the chakra class. It really doesn't have anything to do with the chakra. It's just a nice little gift to have in there. But Samantha doesn't even put a name on it. She just draws a big heart on it because she calls it her heart oil, because it just makes anything feel better. Like you have an ache or a pain or something like that. I mean, just the oils without the essential oils in it works really well. When you add the essential oils, it's pretty darn yummy. Yeah.
I'm just making sure everybody knows it's my new favorite.
Yeah.
And it is, it's called Arnica Complex. It is not on the site yet.
No, yeah.
It's on the kit if you're
Yeah.
doing the chocolate class next week.
Yeah, but
It is what I.
the arnica essential oil is super hard to get and expensive. But we just made it into an ointment, so it makes it affordable. And well, in this case, it's just in your kit. So
Questions. So as far as you let us know the carrier, what would be the application for lymphatic blend? I don't know.
what are you trying to do with it? Is it, if it's for this, I'd rub it on the neck, the throat, across the chest a little bit, and in and around the armpit. But if you have another application or another thing you're trying to target, let me know and we can talk you through that part.
When they first, one of the shares, when we first started doing it, they said their armpit is tingling.
Yeah. Like it definitely gets things moving. Like it.
And someone said my right side is cooler. So when we did the left side, the right side actually felt cooler. Can we use this one for children?
Yeah, for children, that's a very good question. How old are you thinking? Like how old is the child? Are you just asking in general? Yeah.
No response.
Okay. I would say if the child
Oh,
is
they did 3.
3, yeah, probably just a drop of bay laurel should be fine, and then like in some lotion and just rub it on the areas. That should be good. But I think the use of thyme linalool for something like that, it's a really soft thyme. It's a great way to stimulate the immune system in an infant or child or up to about the age of 7 or 8. I usually use thyme linalool. If they seem like their constitution is a little bit stronger, because the thing with the essential oils, you don't want to be too overwhelming with that. So if their constitution seems a little stronger, you could go to the bay laurel, but still a minor dosage, very, very soft dosage.
Are all breathing exercises in through the nose, out through the mouth?
Yes. And part of it is, for one, you're calming down the stress response in your body, but you're trying to get the molecules into the tissue of your respiratory tract. So by inhaling through the nose, it's hitting the respiratory tract, landing on the membrane so that it gets into the bloodstream. And then you don't want to just blow back out your nose, because then you're blowing some of those particles back out. So if you go in through the nose and then out through the mouth, you're getting the most efficient way of getting essential oils into your system through inhalation like that. So wouldn't change, even if you were to treat something else, it would still kind of stick with that format. And
if the tonsils have been removed?
Then no big need to go through and clean up those tissues. If they're removed, I just stick with the bay laurel and call it good. But if you still have your tonsils, I mean, back like when I was young and a little bit before me, a lot of times they would just take the tonsils out. Like say there was 4 kids in a family and one of the kids got tonsils, everybody got their tonsils out, like just everybody. And so for a while, the rule of thumb was that doctors would just take the tonsils out. Now it's not so much like that, but if they're out, no big deal, but you don't have to treat it. Like I would just stick with the bay laurel or the turmeric, the ginger, and that probably calls it good. So.
I think it was when you were talking about the bay laurel, someone said, I put a couple drops in my laundry, in my load before.
Oh yeah, that's good. Yeah. I used to do that with tea tree. I used to put tea tree in my laundry. And it took a while ago, but just to kind of clean things up and freshen things up, energetically clean it. And
The right armpit was jealous when I was working on the left armpit. There is a couple more underneath. I just want to make sure I got all the main ones. Are we covering halitosis at all today and how it relates to today's topic?
yeah, bad breath is actually right after asthma. If you go back up to the top, I'm glad to talk about it if you'd like. Up on
And I sent you the link. If you could.
yeah, I switched over.
Page 5.
Yeah, it's at the top of page 5.
Yeah.
5.
That he said that.
Yeah, top of page 5. And so here I just listed bad breath, but it's also called halitosis. And so, there's just like a lot of times fennel is used for that, cardamom or fennel, but peppermint, covers up the odor and it kind of stimulates things in the mouth. But for like kind of chronic bad breath, a lot of times there's other issues other than just a bad smell in the mouth. So I kind of listed like the brushing and flossing, if there's an infection or something or a cavity, yeah, the dry mouth, Shazandra can help when things are dry. I saw saliva and I was seeing it as salvia. And I was like, I put salvia instead of sage. Like that was really weird. But it's saliva. My dyslexia was kicking in. And then, foods, but smoking, medical conditions. A big one for bad breath is either usually a digestive issue or dehydration. So I would say fennel or cardamom. And if you think it's dehydration, then use Shazandra. Use one of those three. That usually will knock that out. They do need to be internal. It does need to be either in a mouthwash or a few drops taken internally. But Shazandra definitely internally, but the fennel and cardamom, fennel gets used in some of the Chinese medicine approaches to improving gum health and things. Cypress could potentially be used. I've never found cypress to knock out the bad breath, but it cleans the mouth up. And so one of the things that you can use to augment as well is the use of chlorophyll. You get the chlorophyll drops and put it in your water and drink it, or you have the tincture with chlorophyll or the tablets. That can clean things up quite substantially as well. So, yeah.
Will you put the arnica one on the website?
Yes, of course. Yeah, we just hadn't. It's been a little bit of a crazy week this week, so we're a little bit behind on my writing's a little bit behind, and getting things on the website's a little bit behind. Not bad, but just a little bit.
Someone said the little 3-year-old gets ear infections a lot.
Yeah, the Tylenol should help with that quite substantially. Kind of a common thing, but you have the right idea, like going through and working these areas. I even did a little thing where I took some Tylenol and I put it in a a little bit of alcohol, made like a little body tonic, and I shook it up and I rubbed it on the chest and neck, and I did it a few nights in a row. It felt so good. Like it felt so good just opening up the chest, and it's moving lymph, it's getting blood and circulation to the muscles, and it's helping to release the muscles that help elevate the rib cage. You could do a version of that for the child, but remember, you got to do really small dosages. So like a drop in lotion, then rub it, do the neck, the shoulders, and even down the arm a little bit, and then go to the chest. And you could even do a little bit on the abdomen. Do the abdomen last. With a child, if you go right to the abdomen, it tenses them up. Their body goes into protecting the internal organs. So if you start rubbing the arms and the neck and on top of the shoulders and down the chest, by the time you get to the abdomen, they're relaxed and it doesn't matter. But if you go right to the abdomen, their body will tense up, just as a protective response. So if you do that kind of regular, I have had crazy healings with children with Tylenol. I mean, I'm trying to think. Several cases of jaundice, cleared up like that with Tylenol. Kids that were just really prone to infections and getting colds and flus and just getting sick all the time, started giving them, like I would take a glass of water, put a drop in, shake it up, and just give them like a couple spoonfuls, and then have the mom, every day just take a spoonful out, put it in their mouth. And it was amazing the difference that it made. And the thing with the Tylenol, it's safe enough for the child. It's not overwhelming or overstimulating to the child. And it really increases the immune system for an infant or a baby. And so there was a couple other liver issues that would happen with babies, like right after they were born. I would give them Tylenol, it would knock it right out. So even anything liver oriented, you just go right for the Tylenol. Yeah.
Is there anything for loud snoring? My husband is really loud.
Yeah, again, not a lot of great treatments for that. We talked about putting the thyme and alcohol on the chest and loosening up the diaphragm when we were talking about asthma. If you go back to kind of the asthma treatments, it can be helpful for that, but it probably won't knock it out. But again, the snoring a lot of times is the muscles in the neck are constricting, and there's some structural issues and things, but the more you could open up the neck, a lot of times the snoring will diminish. It doesn't mean it will go away, but it will diminish. And so, yeah.
All right, and there's a question here that I can answer. So
Okay. Let's do this. Let's go ahead and take a break for just a little bit, and then we'll come back and we'll do another round. We're going to come back and talk about coughs, and then anything, free form of any sort of respiratory thing that you want to talk about. I wanted to hit the big things, the really common things, but if there's something here that we're not addressing or you would like to address, let's bring it up in this next segment. So I'll see you at 35 after. Hey, everybody, let's come back and let's hit the top of page 10 and start looking at coughs. So there's different kinds of coughs. I listed them: dry cough, wet cough, chronic cough, acute that just lasts for a couple of days to a couple of weeks, a nighttime cough. You might not cough all day, but then when you lay down, all of a sudden you start coughing. That is a thing. And then a spasmodic cough, which is actually not really related to respiratory function, but the muscles that are associated with elevating the rib cage. So they are it is associated with the respiratory tract to a certain extent, but a spasmodic cough is these two rope muscles that go down each side of your neck. They're in a bit of a spasm, and they'll cause a cough that doesn't produce any mucus or anything. It's just a, you're just constantly having this kind of cough. The other thing to keep in mind with dealing with coughs, it's trying to clear something out of the airway. Most times it's mucus, right? But sometimes what happens is, like, dried mucus can be in the lungs, stagnant lymph can be in the lungs, or things that you were exposed to in the air get stuck in the lungs, and then it's a hard thing to come out. Like, for example, I had one patient one time. They were like back in the backcountry, like driving in the mountains out in California, in the middle of nowhere. And they hit this section where the dirt was really soft and it was really fine. It was like chalk. And it was just like they said, the car sank down all the way to the to the frame. And even with the windows up, there was just dust everywhere. And that guy coughed, I think, for 4 or 5 weeks before he saw me. And we had to go through and just kind of detoxify the lungs with that. And the concern is, especially out in California, that there's a fungus that lays dormant in the ground in certain areas. And when the dust comes up, these spores will hit the lungs and then cause like little growths and things in the lungs. Probably too much information for you guys, but West Coast people know it as valley fever. But very treatable, but you really, it takes a skill set to treat it and to make the little growths and cysts go away. But like, here are some of the symptoms. Like, so think about this, like with COVID, what was one of the big complaints that you would hear a lot on some of the Zooms and everything? Like tightness in the chest or chest pain. That is just from the constant coughing. You literally kind of strain the muscles in the chest. So we had several people, including some members of my family, that they would call me like after the fact, and they would say that, they thought they were having a heart attack. And so they would go, or, like heart issues, and they would go in and the doctor would do, all the testing and ultrasound and everything. Heart was fine, but the chest felt like a cardiovascular issue was happening. And you see that sometimes with asthma, where there's like chest pain, especially on the sternum. It feels like an elephant standing on your sternum. It's just the tight muscles from the strain of breathing and the coughing. Can't catch your breath again. High-pitched whistling sound when breathing, scratchy, painful sensation in the throat, feeling tired, runny, stuffy nose. Sometimes fever can be present, especially if it's due to infection, and hoarseness can be there. It's usually due to irritation of the throat. And so there's lots of choices here with coughs. And I listed a couple of different kinds of coughs, including whooping cough. Sometimes, if I remember right, that's also known as pertussis. Something like that, pertussis. Does that sound right? I can't remember. But, any of these things will kind of work. Hyssop could be a go-to one. Sitka could be a go-to one. Kind of a sleeper in this is Tolu balsam. And Tolu balsam loosens up like kind of the more core muscles in the throat, not necessarily the outer like skeletal muscles, but you would use Tolu balsam to treat croup. And it's when the airway kind of shrinks and gets so tight that it just keeps getting smaller and smaller. Tolu balsam will open that up And so sometimes I've used Tolu balsam for just like weird coughs, but anything that is a balsam usually can be soothing to the respiratory tract in some of these cases. So fir balsam, Peru balsam, poplar balsam, anything that has that balsam effect and can be helpful. And so with a chronic cough, again, I tend to go hyssop. If you're a little bit sensitive to hyssop, anula or myrtle can be a super good choice. And then the spasmodic cough, larch can be helpful, but again, I kind of go hyssop decumbens. And keep in mind, the use a little bit of an anise internally, or that blend aerophagy from the lymphatic class, like a couple lymphatic classes ago, which is tied to the gulping of air. So it's tension in the stomach, but it causes tension up in the throat and can actually cause some coughing. Whooping cough. You don't see that in adults very often, but pre-COVID, like I'd say maybe 2 years before COVID, there was a really bad flu that went around, and the death rate was actually elevated. Usually about 70 to 80,000 people in the US die from the flu. This is pre-COVID. And I think that year it was like 100 or 110. And part of it was that some people got croup and some people got whooping cough. And whooping cough is usually like a childhood thing, but you see it more and more in adults these days. And the thing that I would also say about whooping cough, sometimes people have whooping cough and it gets diagnosed as COPD. And so I'm not saying if you got diagnosed COPD or somebody that they have whooping cough, but COPD gets better with treatment. Whooping cough sometimes can go away on its own, but it can be pretty bad. So I gave you some choices. And again, just to throw out a reminder, if it seems really bad, I do have this oil, asafoetida. It does work good. It is really stinky and it stinks for a couple of days, but it penetrates lung tissue better than anything else. And things that like whooping cough, it's probably one of the best things to treat. But I mean, it smells like onions that have gone bad, or I mean, it is just a weird smell. The herb doesn't smell as bad, but nowhere near as potent as the oil. I bought half a kilo just to have it because it's hard to find. I will probably have 3/4 of a half a kilo in my 90s, because I mean, you just don't use it that much. You use it in really extreme situations, and when things just won't clear up, that's the thing to go to. And so we can always use that if you have some sort of coughing issue that's just not resolving. But I usually don't even jump to that until like everything's been exhausted, because it's a disruption to your life. You got to use it for several days in a row and it makes you stink. Like I'm just borderline or just putting it on the line there. It's a stinky one. Like the only thing that stinks as bad as it is onion essential oil, which I have as well, but Samantha will not let me open that in the house. Like it is off limits. So anyway, let's have some questions about coughs.
The second is I'll make it so you can unmute her as well. What I saw. Is it, someone's asking what is Essence Kit protocol referring to? Is it in cough area? I don't know.
Oh. It's like one of the kits that we have for, I think, I don't even know. It might not even be a thing that we put, or we took down off the site. I'll have to, like, this is out of my notes, so I'll have to verify that on the website, but I think I did a kit for relaxing smooth muscle of the respiratory tract and digestive tract. But honestly, I don't remember. I'll have to look that up on the website and get back to you on that. It was in my notes and I didn't think anything of it, but now I'm not sure. So,
And we don't have Robert to
yeah.
need everything for us today.
Yeah. Before we go much further, like also what I'd like to ask, this layout of the booklet with the information and laying it out like this, was this helpful, not helpful? Is it confusing? Does it get in the way? Maybe a little bit of feedback, good or bad. Let me know just so I can adjust it, because I want this to be a thing that is super user friendly for you guys. So maybe let's just take the next couple minutes and get feedback on that.
Okay.
Don't feel don't worry about hurting my feelings. If it's like, this is horrible, like tell me, like just, I'm trying to adjust it to you guys the best I can.
And then after somebody did have themselves unmuted.
Okay.
So,
Let's do the coughs first and then we'll do the,
well, it might be cough related.
okay,
But
fire away.
we're having a lot of helpful, great, really, really good, very helpful, very helpful, very helpful.
What I'm curious, what would make it more helpful? Like what would make it easier to use for you guys? Like just give me a little bit of feedback if you don't mind.
Will they type in the feedback?
Yeah,
do
go ahead and
the
let this
unmuted
person. Sure.
Yeah, and then I have another cough person. So go ahead, Lucinda.
Hey, Cindy.
Hi. So, on the whole thing of cost.
Mhm.
Oh, but by the way, the booklet is great. What would be helpful if there was more, of like how many drops you would use for,
Okay. Yeah,
you know,
most times I try to do like, are you talking about internal or just across the board?
well, just across the board, how
Okay,
do
I can
you,
do that.
how would you use it? Not just inhale it, but 3 times a day or
Okay,
a little
good point.
direction with that.
Yeah, good point. Okay, I'll
So-
work that in.
Thanks. So, back to the coughing.
Mhm.
You gave me some things to do for the coughing I had before, and now it's down to basically a lighter laryngitis with just like, it feels more like it's an irritation rather than it's still drainage. So, would you still consider that part of the respiratory?
Yeah, so
like a ENT thing, right?
like you have a little bit of cough, but like when laryngitis kind of gets mixed into it, like if you drop down to the top of page 14, well, not the top, but like number 8, there is laryngitis, and it's
Oh, I
inflammation.
haven't seen that yet.
Yeah, that's inflammation of the voice box.
Right.
Lemon internally can be helpful, Neoli internally, even the Kajuput or Kajuput, however you would like to say it. I find this isn't across the board, but I would say like 70 to 80% of the time with laryngitis, the Kajuput will usually knock it out. But if you don't have it, if you have lemon or Neoli, I would jump on those. They
Yeah.
still work really well. Lemon probably takes the longest, but
Uh,
it's still like it within a couple of days, it should produce a result.
Well,
But
I've been using the lemon and some tea tree oil and the Naoli since you had talked to me a few weeks ago. So
well,
we just
like,
gotta wait it out, I guess.
yeah, the thing that I would say is also you guys are in a little bit more of a unique situation because you have that, what's that stuff called? Red tide or
Red tide, yeah.
You have an irritant that is constantly in the air. And so I like doing long-term use of lemon and just rotating these two. I mean, that's the thing is that stuff, just when I've been down there with you guys, like I can feel it in my throat, but then I leave it a couple of days. You know what I mean? Like I don't have the
Yeah.
issue because I'm not living there. And then the other thing is with the hurricane and all the flooding, there's probably a decent amount of mold going on down there. And
Well, my whole house had mold under the flooring
yeah.
after the hurricane.
So
So maybe that's still in the air. I didn't think about that.
yeah. So I would say there's probably some factor that's, between the red tide and the mold. So you can use like savory is really super good for cleaning up the air quality as far as funguses or molds and things are concerned. I do make this blend that it's not my formula. It's a very old formula called fungal support. And it was the very first thing studied scientifically, essential oil wise, was this formula. And it produced pretty amazing results as far as reducing the mold count and fungal whatever fungal contributing factors were around. It reduced it substantially. Like it cleaned up the air quality by diffusing it in the house. And so the mold support is more for the body and for the person, and the fungal support is for the air and the air quality. And so yeah.
All right.
The thing with that is try to reduce it. I don't know that it's going to help the red tide because that's like a bacterial thing, isn't it? It's like it puts like a lot of bacteria in the air. Or
It's
is
an algae.
So I guess that could, the fungal support might still nail that as well.
I don't know. I'll try it.
Yeah. So if you don't
I've never
have
really been bothered by it before, so
okay,
this is the first year I've ever had anything.
might be the hurricane, like with all the molds and stuff.
Yeah.
If you don't have savory handy and you just need a 911 like cleanup of the air, even like oregano diffused can be helpful, or like a really strong form of thyme or cinnamon. And you know what? Let me even look up what's in the fungal support because
That's right. I'm just ordering it right now as we talk.
now I'm even curious to see what fungal support. So palmarosa, savory, geranium, and lemon tea tree. And so the big hitter is the savory, but even palmarosa, geranium, some form of tea tree, the original formula was lemon tea tree, which is what I've used, but any form of that will work.
Yeah, I do have those separately.
Yeah. Savory, savory is very interesting. Savory is an amazing short-term way to treat a lot of different conditions, but you don't want to use it long-term. It's very similar to like oregano or like a really strong form of thyme. But you really don't see it a lot in formulas. And even I forget about it. And then I start thinking about savory. I was like, oh yeah, they're savory. Man, it's amazing. But very good for diffusing in an area to diminish the potential for catching colds and flus, or to clean up the air when somebody's been around and is sick, or in